Yes,
Is there recording or no?
yes, it's recording. Streaming.
Usually it says recording in progress, but hello everyone. Good afternoon, good evening, good morning, wherever you are. Thank you for joining our Sunday webinar for Doctors Against Genocide. And as usual, as was just mentioned, we are always fashionably a little bit late, but better late than never. And again, I think we all share some relief for the ceasefire, some mixed feelings, some happiness for our people in Gaza, that the direct killing of the children, of the mothers, of the civilians has stopped. We know that people in Gaza continue to die due to starvation, due to lack of medication, due to destruction of the healthcare system, due to destruction of the civilian infrastructure, due to disease and outbreaks. But at least there is some relief that the direct killing has stopped for now. And we all have mixed feelings because we do not trust the genocidal government of Israel. We do not trust the regimes, the empires that supported it. And we are worried that they might break the ceasefire any minute. So there is a lot of trepidation. And we all have been working, whether us here, the one who care about life, about the victims, or the people in Gaza, we have been working in a survival mode with high adrenaline, just hoping for the killing to stop. But once this stops, I'm worried, I'm afraid that the reality is going to hit all of us hard, especially the people of Gaza going back to their homes to find nothing, to start thinking about the people they lost, the families, the children, the mothers, the fathers. That's why we cannot let our guard down. We have to stay strong. We have to be resilient, if not for us, for them, because they continue to need our help now as ever. And we need to keep the pressure up on the governments, on the mechanisms that enabled and committed this genocide, because they continue to exist. And unfortunately, we are witnesses in the first time in history that a genocide is being stopped, or they're trying to stop it at the expense of the victims, with full rewards to the perpetrators. And we cannot allow this to happen, and should not happen on our watch. After 2 years of live stream genocide, after creating all this movement of people of good conscience all over the world, we have to stay on watch, and we have to keep pushing for the perpetrators to be held accountable, for the systems that enabled and supported and committed this genocide to be dismantled. Accountability is key here, not just out of revenge, not out of punishment, but they do deserve the punishment. But accountability is important as a prevention. It is the most important thing to prevent this from happening again, whether in Palestine or anywhere else. Because if they can get away with this, no one will stop them from doing it again, over and over again. And no one would prevent would-be genociders or war criminals all over the world watching this. If they see that Israel got away with it easy, they will try to do their own genocides. So as doctors, healthcare workers who care about life, as an organization that is meant to fight genocide and war crimes, crimes against humanity, it is a key role for us to make sure that whoever committed this genocide, the individuals, the politicians, the systems, need to be held accountable to prevent further crimes. And at the same time, we need to make sure that the victims get all the support that they need, and they need it now more than ever, because while we're all confused, while we're all feel I mean, honestly, I've been feeling horrible in the last few days, and I'm sure they feel even worse because now the reality will hit them even harder. So we need to stay on their side. So thank you for joining us. This webinar is going to cover uh, many topics, the genocide in Gaza, in Palestine, in Congo, in Sudan. We have guests and colleagues who have been eyewitnesses. We will have colleagues from Gaza, from Sudan, from Congo talk to us. And we will have colleagues who did go and visit and had missions in the West Bank, in Gaza. Who are going to share with us their eyewitness testimonies. We're going to start today with Dr. Salman Khan. He's an infectious disease physician and assistant professor at Columbia University. He's the founding member of the Coalition of Uptown Health Sciences for Palestine. Dr. Khan just had a recent medical mission to the West Bank. We are grateful for his sacrifice, for his service, and we are happy to have him with us and waiting to hear his testimony and his reflection on what he witnessed there. We also have Dr. Nicholas Maynard, who's going to be joining us soon. He is a gastrointestinal surgeon from Oxford University who have been to many missions to Gaza and who, among with other colleagues, have a very important study published in the BMJ about their finding that the types of injuries that the people of Gaza, the children, the civilians of Gaza have endured is comparable to the types of injuries that soldiers in wartime combatants are getting. So that's another proof that this was not a war. This was a genocide on the civilians, not on soldiers. We will also have many colleagues from Gaza will be joining us soon. We will have a colleague from Sudan, from Al-Fashir join us. There is a genocide going on in Sudan, in Al-Fashir. We heard news in the last 24 hours or 48 hours that more than 100 people have been murdered, civilians, due to drones dropping bombs on civilians. There is a lot of starvation. There is siege on the civilians there, a city of almost 500,000 people. And we will hear from our colleagues in Congo about their campaigns to help the genocide survivors there. So I'll stop at this point and we're going to start with Dr. Salman Khan. Dr. Salman, thank you for joining us. It's all yours.
Thank you so much. It's such an honor to be here with you all. And I'll go ahead and I'll share my screen. Okay. All right. I hope everybody is able to see my screen.
Yes.
Again, thank you so much to Doctors Against Genocide for the invitation. I have no relevant disclosures. And I did recently return from a medical mission with Heal Palestine. This was back in August. I had the opportunity to volunteer in Nablus, specifically at An-Najah National University Hospital. And this was part of Heal Palestine. They have a program where they connect physicians in the United States to hospitals and health systems within Palestine. And so I'll share in the subsequent slides some of my experience. Before doing that, though, I think most of the people in this group are probably familiar with this already, but Heal Palestine, I think a lot of people are familiar with the work that they do with children, specifically children who, for example, are amputees or children who have been severely injured and maimed in Israel's genocide in Gaza. And this actually happened while I was there in the West Bank, where shamefully our US State Department suspended all visitor visas from Gaza. And so this was really affecting children who were just seeking urgent medical attention. So I just wanted to bring this to attention.
So, Salman, before you go further, I
Yes.
just want to bring this up. Two of our leaders here are from Nablus, Dr. Hawash Karama and Maisa. So, You're talking about home. Thank you.
Mhm.
My honor, my pleasure, and I love the time that I spent there and the people that I met there. Thank you so much.
Thank you.
So just this was the drive. When I came through the Allenby crossing, which I think people may have heard. Recently the occupation closed that crossing to traffic, which is a major artery for how most Palestinians in the West Bank are able to get in and out from Jordan. Went to Ramallah, and then from Ramallah went to my assignment, which was in Nablus. And so driving up there, just witnessing apartheid for the first time, firsthand. I'd read about this, of course, and seen this on the news, but to be there in person is something else. And so this was what it looked like on the ground, because I'm also familiar with the maps of the West Bank and how it's really been eroded and divided up by the occupation. And this is what it looks like on the ground. So there's separation walls that stretch for miles. Illegal settlements are everywhere. These are really metastasizing across the land. And every aspect of life is affected for the Palestinian people by this apartheid. For example, my driver was Palestinian. He has Palestinian license plates. He's only able to drive on certain roads there. And so this is just one example. Another example are these arbitrary border checkpoints that result in road closures. This makes just daily existence, daily commuting from point A to point B, going from your town or village to working at the hospital, makes it very difficult, and in some cases dangerous and deadly. So before I go a little bit further talking about the mission itself, I did want to just provide some brief context or background on this major public health issue, which is antimicrobial resistance in Palestine. I wanted to share a little bit of this review article, and this actually, one of the co-authors of this article is Dr. Yara, who spoke at the DAG conference in Ann Arbor recently. And just, what are some of the determinants of antimicrobial resistance, or what might be driving this? And, part of this could be related to antibiotic misuse and overprescribing. And I would say this issue is not unique to Palestine. This is something we see actually in many lower and middle income countries, for example, where some antibiotics are available over the counter without a prescription. In Palestine specifically, I think there's some instances where, because of barriers that are imposed by the occupation to access to care, barriers to transportation to healthcare centers or hospitals, some patients actually are using antibiotics in the household setting when they may not be necessary. Then we have the issue of nosocomial spread. So, this is where infections can spread and amplify in hospital and healthcare settings. Of course, we've seen how devastating this has been, hearing firsthand from our colleagues in Gaza. What can happen is in a hospital setting, there could be overcrowding. There can sometimes, be breaches to infection prevention protocol or infection control protocol. For example, if optimal sterile technique is not available, hygiene is not available, that can result in the spread of resistant bacteria. Patients get exposed to antibiotics in the hospital that can select for the emergence of some resistant bacteria. However, I would say that really is, the tip of the iceberg when it comes to antibiotic resistance. The bulk of antibiotic resistance actually exists in the environment, in the community. When we think about environmental contamination, this is, for example, in the water supply. So in the West Bank, the water even is controlled by the occupation. So doing things like surveillance of the water, making sure that it's clean. These are things that are actually limited there. Agriculture is another huge area where antibiotic resistance bacteria can be bred. And then, of course, those of us in this group, of course, who are physicians, who are public health professionals, we know how important sociopolitical determinants are as sort of upstream determinants in affecting the health of a population. And so in this article, the term de-development of the Palestinian healthcare system was used. And one way that we're seeing that manifest in real time in the West Bank is how the Israeli occupation is actually withholding, I think, over $3 billion in tax revenue in the West Bank. And of course, this is expected to have devastating downstream consequences for the healthcare systems, for the healthcare infrastructure, when you're not able to invest in hospitals, when you're not able to invest in your healthcare workers. Some of the healthcare workers that I talk to, they're really are sacrificing a lot. They're really heroic, and they're dealing with pay cuts, for example, but that's not deterring them from continuing to take care of patients. And when you don't have the infrastructure that's set up, that limits on a populational level to be able to do things like disease surveillance for infectious diseases. It affects things like the supply chain of vaccines and antibiotics, and this can further select for resistance. So just the graph on the right, this is from this review article, and this is looking at trends in ESBL producing E. coli. This is just a type of a resistant bacteria. And so what you're seeing here is that articles that were published as time goes on, they seem to be an increase in the proportion of resistant bacteria. So this is a major issue that Palestine is dealing with. So this brings me to the actual mission itself. So this is me pulling up to An-Najah National University Hospital in Nablus. Just briefly about An-Najah National University Hospital. So it is a 140-bed academic tertiary medical center. So this hospital actually receives referrals from satellite hospitals in the region. And part of the reason for this referral is actually it's a major cancer hospital. So about 60% of the patients are cancer patients. And we see patients with leukemia, lymphoma, myeloma. They even have an autologous stem cell transplant program. I'll also add that Najah Hospital has one of the largest dialysis centers, not just in Palestine, but all of the Middle East. I think there's over 100 dialysis machines that were there. And this also, like I mentioned, is an academic medical center, so it's very closely affiliated with the largest university in Palestine. So they have a robust health sciences faculty and residency fellowship programs and a medical school as well. So their infectious disease department basically is split into three components, which I'll talk about briefly in the subsequent slides. So one is infectious diseases consultation. The next major component is the antimicrobial stewardship program. And then closely related is the infection prevention and control program. So in terms of ID consults, so at Najah Hospital, so Dr. Ali Sabatin, he is their only infectious disease doctor, and he actually commutes from Bethlehem. And so those of you who are familiar, with the geography of the West Bank, Bethlehem is more in the southern portion, Nablus is more in the northern portion. And when you consider, the security checkpoints, the risk of detainment, it actually can take hours to get from Bethlehem to Nablus. And so Dr. Sabatin is only able to come in twice a week. And so I was very happy to be able to, be there for the time I was there and serve as the infectious disease physician for the days he was not available. And they're actually in Palestine. What Dr. Sabatin told me is that there's a shortage in general of infectious disease doctors. So Dr. Sabatin, not only does he work in Nablus, he's also affiliated with the hospital in Bethlehem. He's also affiliated with, I believe, a couple hospitals in Al-Quds. And so, one doctor is sort of literally commuting across the West Bank to be able to provide care. And here, we would do rounds every day that, we're familiar with rounding the same way we do in Western healthcare systems. And because it is a teaching hospital, I had the privilege of working with really talented resident physicians who would present challenging cases to me, and then we would sort of talk through the clinical management. And really, they saw large variety and a large complexity of cases. One just brief example was a young patient in his 20s. He had acute leukemia. He had recently undergone induction chemotherapy. He was neutropenic. He was febrile. He actually had bacteremia from a very resistant organism, which is a carbapenem-resistant Klebsiella bacteria. And actually, because in part, due to limitations that are imposed by the occupation, the hospital actually did not have the optimal agent that we would use to treat this particular bacteria. So they were sort of making do with second line antibiotics, and ultimately that patient ended up getting a splenectomy for source control because he had a splenic abscess, and thankfully was doing okay. Then later I heard the update that he had actually developed a brain abscess and ended up having to undergo a neurosurgical procedure. And last I heard he was in stable condition. So this is an example of the cases that we would encounter. The residents and the physicians here just really astounding and just making the most out of limited resources. So next, to turn the attention over to the antimicrobial stewardship program. So these have increasingly, become a standard in hospitals across the world, and the goal really is, how can we optimize antibiotic use in the hospital setting, and the goal, of course, being, to of course take care of patients, improve quality of care, also to limit the emergence of resistant antibiotics. So in the photo here, actually, Dr. Banan, who is in the middle, she is the leader for the hospital's antimicrobial stewardship program. She's an infectious diseases pharmacist by training. Really, just is responsible for the day-to-day activities, and so, rounding with the teams, reviewing in real time the antibiotics. Is the patient on the appropriate antibiotic? Is there room for, de-escalation and sometimes escalation of the antibiotic regimen? Avoiding, broad spectrum antibiotics when we can. Is the patient on the correct dose? Is the duration of therapy correct? And, I will also just say to Dr. Banan's credit, and this is, one example of what many of the healthcare workers deal with. She is actually coming from a village outside of Nablus, and she has to commute to work every day, and that is a challenging commute for her, because her village has been subjected to violence from the occupation. So every day, just getting to work and leaving work and going back home is in itself a challenge. This is just an antibiogram. So some of us are familiar here. This is just a tool that stewardship programs use to track and monitor, resistance among different types of bacteria in the hospital. And this helps to guide, what is the best empiric antibiotic. And without going into too much detail, I'll just say, the red here is bad, green here is good. You're seeing there is unfortunately a lot more red, and this just means that for each, sort of the rows are different bacteria, the columns are different antibiotics, and so there is a large proportion of bacteria that are resistant to many of the antibiotics. Moving on to the infection prevention and control team. So this is just sort of an example of some of the outcomes that they measure, their key performance indicators. So again, without going into too much detail, they look at different things like surgical site infections, which are SSIs, CLABSIs are line infections, CAUTIs are basically urinary catheter infections, VAPs are ventilator-associated pneumonia. So all of these outcomes, can be prevented, excuse me, to some degree by employing, evidence-based practices, and the infection prevention and control program is responsible for overseeing this. This is just sort of a graphical representation. They're measuring sort of a composite of hospital-acquired multi-drug resistant organisms over this 3-year period. And you can see there appears to be a downtrend, even though, as we saw in the earlier slides, in the community in general, there might be an increase. So this is in part due to their efforts. And this is just sort of an example of a root cause analysis that the hospital infection prevention and control program will conduct. So for example, the outcome here was that a patient developed the CRE, which is a type of a resistant infection. So a lot goes into, the root cause analysis, what could have been done to prevent that. And so when we're talking about things like nursing ratios, when we're talking about, is there cross-contamination, or there potential, areas in housekeeping or cleaning of the room that could be optimized? Is there an isolation policy, for example, that's in place? So just to give an example of the many factors that that the team tracks and responds to. I will say one of the most rewarding aspects of being there was actually getting to work with the medical students and the residents, and these young minds. These are the future of the Palestinian healthcare system, and they are just so enthusiastic. They're so motivated. Really talented, really bright, and we talked about various things. We talked about how to approach infections and immunocompromised patients. Because this is a hematology oncology specialty hospital, we did talk about infections such as fungal infections that disproportionately affect that population. With the medical students, we sort of had them go through cases and just how do you approach, constructing a differential diagnosis, and based on your exam, based on your history. So this was just a really rewarding aspect of the experience. And I wanted to just touch briefly on what it was like being, what it's like being a healthcare worker under occupation. And this are, just sort of directly me speaking with some of the nurses and the doctors there, just interacting with these really wonderful, compassionate, and resilient human beings. And they're so motivated, and they do their work with excellence. They give it 110% every day. They come to work with a spirit of optimism that is contagious. And that is, despite the immense chronic trauma that they face. So just some of the personal accounts, one of the healthcare workers I spoke with told me he was suffering from what really sounded like an irritable bowel syndrome. And this is just related to the day-to-day stress of existing under occupation and coming to work under occupation. Another healthcare worker I talked with was dealing with chronic insomnia. Healthcare workers have either themselves experienced or directly witnessed physical violence at the hands of occupation forces and illegal settlers. So one of the amazing nurses I got to meet, she actually invited me to her family's village, which is outside of Tulkaram. And we were sitting there, we're eating dinner. I'm looking at, there's a house basically across the way from her that we can see. And she's telling me the story of how a year ago, the occupation, Tulkaram was under a big siege from the occupation last year. And they basically put a siege on this house for 12 hours. They ended up killing the residents of this house, and this nurse witnessed firsthand her neighbors being murdered by the occupation. On the right here, this is Tamam. So Tamam was a beloved dialysis nurse at Najah Hospital, and he actually was martyred about 4 months before I went there. And the story was that he lives in Jenin. He commuting from Jenin to Nablus, just being a healthcare worker, he had witnessed one of the occupation forces had injured somebody on his commute to work. He, being a compassionate person, stopped to help this person who was injured. And what was the consequence of this? The occupation forces dropped a bomb on him and they murdered him. And so this was just a huge loss for this hospital. And we know that losing a healthcare worker has major effects, for example, even on infection control in a dialysis unit. You can imagine if you have a staffing shortage, this is going to have adverse outcomes. So this is just one example of what they deal with on a regular basis. So yeah, I really just wanted to acknowledge and just express just immense gratitude for these courageous and resilient healthcare workers that I met. It was such an honor for me to just be there for the few days that I was there. I think I grew as a physician and as a person, and so really just thank you to the healthcare workers at Najah National University Hospital and the healthcare workers of all of Palestine. So I'm not sure how I'm doing on time, or like if I have time to talk about going to Al-Aqsa, or if we have the next speaker.
Sure. No, sure. You can have a couple of minutes. Fine.
Okay, great. Thank you so much.
Because I miss hearing something about Al-Aqsa.
Okay, thank you. Yeah, my honor. So this was actually after finishing the work week in Nablus, I really was blessed to be able to go to Al-Quds and staying in Silwan, which is one of the Palestinian neighborhoods near East Jerusalem, walking distance actually from Al-Aqsa. And for me, this was just a really big deal. Just personally, I'm someone who reverted to Islam a couple of years ago, and to be able to go to Masjid Al-Aqsa was just like a life-changing experience. And I just wanted to convey to the group here that even my attempt, and I'm an American citizen and I'm not Palestinian myself. Maybe I pass. I look a little bit Palestinian, but I'm Pakistani background actually, and twice attempting to walk to Masjid Al-Aqsa, which is, our right as Muslims to go there. Twice I was blocked by occupation soldiers, and these were armed soldiers. They were just really inhumane, and just being physically manhandled by them, stopped and frisked, being told by one of the soldiers to go back to America. So twice I was blocked from entering Al-Aqsa. Thanks to God, for the third time, I didn't quit, and I asked the coffee shop owner, what should I do? Like they're blocking me. It's like, don't argue with the soldiers, just keep trying. And thank God I was able to actually get in to Al-Aqsa, and just a really profound experience of my life was being able to make Friday prayers at Masjid Al-Aqsa, and this is the most sacred day of the week for us Muslims, and Masjid Al-Aqsa is one of the sacred sites for Islam. And one thing that happened there actually, I got there a few hours early, just anticipating, potential delays. And I'm sitting there, I'm just waiting for the sermon to start reading the Quran. And something I totally do not expect to happen is that three open caskets are brought, and I'm sitting in the front row, and three open caskets are brought, and the bodies are, of course, they're shrouded, as in this picture. But by the way, this picture is from Reuters. This was from Gaza in the beginning of the genocide, and we've all gotten very, very used to seeing these types of pictures, and of the janaza, the funeral prayers. And I was just thinking, as a physician, we encounter death with regularity, but this really took me by surprise. And even in Al-Aqsa on that day, there was a lot of, I would say, people were angry, rightfully angry about all of the injustices that were happening. We've seen all in the news, how this was, I think, actually last year in Ramadan, when the occupation soldiers invaded Al-Aqsa and attacked worshippers. Then literally 1 week to the day before I went there, thousands of these illegal settlers basically invaded the compound, which it's a huge crime. And really, I think the spirit when I was there was one of hopeful defiance. And so this actually was the week or 2 weeks after I went. Ever since the genocide had started, the occupation had basically imposed severe limits, even on Palestinians in the West Bank, to be able to go to Al-Aqsa. And so a lot of people really, risked a lot to be able to just go and go there. And for me, this was a pilgrimage, but it was also a form of protest. And so I hope I can go back, and that we can all see a free Masjid Al-Aqsa someday. So just finishing up, I wanted to just share this slide. This actually is from just on Friday. I got the permission from a group of medical students at Columbia to share this, and they actually arranged a die-in outside the hospital. And this is just to sort of expose the hypocrisy of our healthcare systems, who purport to be for human rights and healthcare as a human right, and yet are so morally bankrupt when it comes to the genocide in Gaza and all the health injustices in Palestine. So I am so immensely proud of these medical students for being on the right side of history. And just to finish off on a happy note, so this is little Amir. So Amir is Muhammad's son. Muhammad is one of the nurses who who I met with I worked with in Najah Hospital, and he is harvesting olives right now. It's just the beginning of olive harvest season in Palestine. So this is his family's land in the village of Atil outside of Tulkaram, and he's just the happiest 5-year-old. He loves Spider-Man, and I just hope he can have a better future, and all the children of Palestine can have a better future. So thank you so much for the opportunity to share.
Thank you. Thank you, Dr. Salman. That was very important and great. The insight about the drug resistance, about the the restriction they put on the healthcare, even in the West Bank, and how this can translate into, dysfunctional care, increase of drug resistance that can have repercussions beyond Palestine also. This is very important. Thank you for your sacrifice. And recently, there was also a protest here in the United States for, alumni or healthcare workers against the healthcare system here, and the complicity of the healthcare system in the West, especially in the United States, with this genocide, their silence, their enablement of this genocide. And you had very good points. If you don't mind, I want to really have everyone hear those. The point that you made about the complicity of the healthcare system here, about the medical neutrality, about the abuse of these, terms to justify silence on mass murder. Fadl. You are muted, Salman.
Oh yes. So yes, I think you're referring to so yeah, this was recently, this was a joint action that a group of faculty at Columbia had organized, and I think people know, like the encampment movement. This initially started with the students at Columbia, and many of them made huge sacrifices in terms of expulsion and being put into jail just for speaking the truth. And shamefully, Colombia, rather than being on the right side of history, they recently, in what I'll say is not just a capitulation, but a collusion with the Trump administration and some of the Zionist faculty at Columbia, they adopted this IHRA definition of anti-Semitism that basically says, like, you're not allowed to criticize Israel for its crimes, or you're going to be accused of anti-Semitism. And so a group of us, we just, we're saying that this is completely unacceptable, and we refuse to comply with this, and we're going to openly challenge this. So I was very honored to just join a group of faculty, and many of them were Jewish faculty, and just to speak out on the main campus. And sure enough, we did speak out. And what was the university's response? The next day they ended up erecting a fence around the area. So it's like, it's amazing, some of the analogies. Yes, how our campus and the analogies with what it looks like in the West Bank, when you have a militarized campus, when you have censorship, when you have literal fences that are being erected to prevent people from moving about and doing the right thing. And I'll also just say, the other day now, it was the anniversary of October 7th, and Columbia gave a space for pro-Israel on the very area where we were speaking. Israeli flags, shamefully, of this genocidal entity were flying. On the same time, actual tuition-paying Columbia students were kicked off of their own campus, and they had to do a counter protest on the street outside. So this is just so shameful. And I know it's not unique to my institution. This is a pervasive issue across our different health systems, but thankfully we can all work together.
Yeah. You made like a couple of minutes, a speech for a couple of minutes on that occasion. Do you mind if I play it here for everyone to hear it? Because I read you made a strong point. I hope they hear from my phone.
Yeah, inshallah, please you can share. Thank you.
At Columbia University Irving Medical Center, I recently returned from a medical mission to the occupied West Bank. I witnessed firsthand the Israeli occupation's infrastructure of apartheid. Separation walls sequester Palestinian communities. Israeli settlements, which are illegal under international law, continue to metastasize on Palestinian land. My colleague and I were arbitrarily detained at a border checkpoint for 5 hours simply because he is Palestinian. Palestinians are subjected to brutal violence and displacement from occupation forces and illegal Israeli settlers alike. The IRA definition harmfully conflates criticism of Israel with anti-Semitism. This conflation serves to shield Israel from accountability in the face of racially motivated apartheid and ethnic cleansing and an ongoing genocide in which Israel has targeted and destroyed nearly all of Gaza's healthcare system in what has been termed a medicide by the United Nations. Patients in Gaza are forced to endure compounding traumas perpetrated by Israel, including forced starvation and mass displacement. Children are shot in the head by snipers and maimed and severely burned by bombs paid for by American taxpayer dollars. Israel has imposed a blockade on life-saving medical supplies and medications, including antibiotics and analgesics. Silence is complicity, so adhering to the IRA definition would make me complicit in Israel's crimes. As a physician, I took an oath to do no harm. The IRA definition prevents me from fulfilling this oath. My moral obligations as a physician.
That's important. The IRA definition prevents us from fulfilling our mission as doctors, healthcare workers, and protectors of life. So that's a profound point, and I really wanted everyone to hear, and thank you for bringing this up.
The IRA definition prevents me from fulfilling this oath. My moral obligations as a physician require me to defy this definition. So I do declare, Israel is an apartheid state, Israel is a racist state, and never again is now. Thank you.
Thank you, Dr. Khan. Thank you, everyone. We're really honored to have you. For the sake of time, we're gonna move with our next panelist, and hopefully at the end we can have some space for questions. We're going to go with another medical hero, Dr. Nick Maynard. Dr. Nick Maynard, he is a true hero and representative of the medical community all over the world. He has been to Gaza many times and many other places as a doctor whose oath also propels him to be on the side of the victims and save the victims. He went to Gaza on multiple missions, and he also published a lot about what he saw in Gaza. They had many publications about the systematic destruction of the healthcare in Gaza as an evidence of genocide. And their latest, their latest article in the was published lately about a couple of weeks ago in the BMJ, British Medical Journal, that it was actually a collaborative effort of more than 70 healthcare workers who have been to Gaza, who witnessed that the type of injuries that the civilian people in Gaza, including the children, are comparable to what they saw. Injuries have been sustained, in soldiers in other conflicts, which also are another proof that this is not a war, and it's not a war between two armies. While the type of injuries that the civilian people are sustaining are comparable to the injuries of soldiers. So Dr. Nicholas Maynard, he's a consultant gastrointestinal surgeon. He works at Oxford University Hospitals. And again, he recently came from Gaza from yet another mission. And we are really honored to have him. And as Palestinians, we are really thankful to Dr. Maynard for being a strong voice for the children of Palestine, the civilians of Palestine, for the truth. And as doctors and healthcare workers, and as doctors against genocide, we are really honored to have Dr. Nick Maynard as a representative of the true medical community, of what true medicine should be. So Dr. Maynard, thank you for coming. You're welcome. It's all yours, and feel free to share your experience in Gaza. I know you've been there before the genocide and during the genocide, and you had a lot of work through the time. We're happy to hear everything from you, everything you want to share.
Thank you very much for asking me on. Can you see my screen?
Yes, we see it very
Good.
clear.
So I'm going to show just a few slides to illustrate some of the things I talk about when I talk about what I've seen in Gaza, and then obviously I'd be really happy to have a sort of interactive discussion. I've been going to Gaza for many years. I think the first time I went in 2010. I've taken a team of doctors from Oxford out to teach for many years. We teach medical students at Islamic University of Gaza and Al-Azhar University. And this is just a photograph from one of our many trips. Clearly, we haven't been since 2022. We were meant to be going in November 2023, but obviously we couldn't go. I've also been heavily involved with going out to Gaza with medical aid for Palestinians, and it's wonderful to see my wonderful colleague and mentor Sui Ang, who founded Medical Aid for Palestinians, on the panel today. But I've been privileged enough to go with Medical Aid for Palestinians for several years, helping them develop their cancer services. And since October 2023, I've had several trips out to Gaza with Medical Aid for Palestinians. And what I sort of focus on a lot in some of the talks I've given since in between my visits to Gaza and a lot of the media stuff I've done, trying to highlight the direct targeting of the healthcare system, the whole infrastructure of the healthcare system in Gaza, and the direct targeting of healthcare workers. We'll be familiar with the figure of 66,000 killed, which is the official figure. But of course, we all know that is a gross underestimate, not only because of the many thousands who are still buried under the rubble, including friends of ours, but also the excess deaths from non-trauma related deaths. But we know there's been well over 1,600 healthcare workers killed. We know there's been nearly 500 healthcare workers who've been abducted, illegally detained, tortured, and many of them killed. And of course, every single hospital has been targeted. Many of them have been destroyed in Gaza. The targeting of healthcare workers, which I've witnessed, we've all witnessed, which is very clearly deliberate, targeting these healthcare workers, and they're 3 times more likely to be killed in Gaza than other civilians. This is another paper that we've submitted in recent weeks, and the average of 75 healthcare workers have been killed per 100,000 of the population in Gaza, and that's compared to 0.8 in Ukraine, 0.3 in Myanmar, 0.3 in Sudan. So a hugely higher ratio of healthcare workers killed in Gaza than all the other war zones in the world. The sorry, the thing doesn't. And this is a photograph on the right that I took when the last time I was in Gaza, before October the 7th. I was there in May 2023, carrying out a week of cancer surgery at Shifa Hospital and European Gaza Hospital, and I put this photograph in it to illustrate the nonsense of the propaganda we hear repeatedly and sadly perpetuated by our media in the UK and our government, that the Israeli military assault is trying to protect civilians. That picture on the right is a photograph I took from the hotel I was staying in Gaza City in May 2023, when it was the last massive sustained aerial bombardment before October the 7th. Of course, it's been dwarfed by what we've seen since then. But this was 4 days of non-stop aerial bombardment, which I witnessed with my own eyes. The Gaza was locked down. We weren't allowed to leave the hotel. We ended up being evacuated by the United Nations. But what I saw with my own eyes, because we were in the middle of this, I saw the sophisticated targeting by the Israeli Air Force of single floors of buildings, sometimes single rooms that we could see, where they were targeting particular individuals. And during that military assault, the amount of collateral damage was relatively little because they were able to target with high accuracy where they wanted to. And of course, we move forward to what we've seen in the last 2 years, and there's been widespread destruction of most of Gaza with no attempt to protect civilians in any way at all. And of course, that is why those of us who've been in Gaza, we have found that 75% of the people we've treated have been women and children. And that has been reported by many different reporters, that the majority of people being killed in Gaza are innocent civilians, and the majority are women and children. We know how many children have been killed in Gaza. When the graph on the left was first written, that was in November 2023. At that point, there were 136 children being killed on average every single day in Gaza. On March the 18th, the day that the last ceasefire was broken by Israel, 174 children were killed in one day. And the average over the 24 months is about 30 to 35 children every single day, the median number of children being killed in Gaza. And that must be compared to the ratio in other conflicts. In Ukraine, the equivalent number is 0.7, in Iraq, 0.6, in Syria, 3, Afghanistan, 2, in Gaza, over 30 children per day. And there have been more children, as we know, killed in Gaza in the last 2 years than in all the conflicts in the world put together over the last 8 years. These were typical scenes that we see every single day in the operating theatres. I'm a surgeon, so I spent every day operating on major thoracic and abdominal trauma. And I saw on countless occasions the appalling damage being inflicted by the fragmentation missiles, which have been commonly used by the Israeli military. These are missiles which are designed to cause maximum tissue damage in humans. Each missile contains many thousands of very small metal pieces, which cause the most appalling damage to those who are caught in the range of these missiles. And this is a typical scene causing extensive damage. This particular patient had shrapnel damage involving the right chest wall, the right lung, the diaphragm, the liver, the duodenum, the small intestine, the colon. Extensive surgery to save his life. And these are typical scenes. This is a compilation of Al-Aqsa and Nasser Hospital emergency rooms, both hospitals I've worked in the last 2 years. Again, you can imagine the scenes of multiple mass casualties we were seeing many days. And most days we worked there, often completely exceeding the capacity of the hospital, and therefore people frequently dying simply because there was not enough capacity to treat them. This is the paper that Nidal referred to. I contributed data to this. I was only peripherally involved in writing it. Omar Al-Taji, who's been at Gaza, did the majority of the work, and I know Sui contributed to this as well. But this is a very important paper, and it describes, this is just one bit that we've reported, it describes the injuries that over 70 of us saw and operated on when we were in Gaza. And this specifically talks about the war injuries, this slide, about the gunshot injuries, but the majority of patients we saw with shrapnel injuries, although I must say on my most recent trip, I only returned at the end of July. In my last trip over 4 weeks at Nasser Hospital, I saw a huge amount of gunshot wounds, which I'll come on to in a minute. But this paper that Omar's written and we've all contributed to shows very clear evidence of explosive weapons repeatedly being used in areas of dense civilian populations, and all of which has been designed very clearly for maximum tissue destruction. And this is an extreme form of high energy trauma, rarely seen in civilian populations, and indeed mimics that sort of damage which is seen in military, in war situations where the victims are predominantly soldiers. And this pattern of massive tissue destruction and injury has been very rarely, if ever, reported in civilian populations, lending weight, lending evidence to what we've been saying for 2 years. This is a direct targeting of the civilian populations using the most appalling weapons, which are designed to kill as many people as possible and to cause as much damage as possible. We also reported much evidence of the public health crisis, which many of us have talked about on many subsequent occasions and occasions before this, and I'll come on to this a bit in a minute, but evidence of profound malnutrition, terrible dehydration, a multitude of different infectious disorders, and of course, inadequately treated, sometimes no treatment of the chronic diseases. There's nearly 400,000 people in Gaza with chronic diseases which have been either inadequately or not at all treated over the last 2 years. And of course, that will lead to many excess deaths as well. We've also seen, many of us, the direct evidence of abduction and torture of Gazan civilians, and particularly Gazan healthcare workers in Israeli prisons. This document, Healthcare Workers Watch, you can, if you haven't seen it, you can Google it, you can read it online. It's very upsetting reading, and this formed the basis for the documentary Gaza Medics Under Fire, which was commissioned by the BBC. But of course, the BBC were far too cowardly to show this film, and it was subsequently shown by Channel 4. But it describes in detail the systematic torture and abuse of Palestinian citizens. Many examples of direct damage and violent injuries being inflicted on male genitalia, particularly distressing for those of us working in the healthcare world. Much evidence of medical neglect, medical negligence, and indeed some examples of Israeli medics taking part in the torture as well. A very distressing document to read. And I won't read this out because it's too upsetting, but those document all the different forms of torture which have been heavily evidenced and described in this document. And much of this evidence has, of course, been submitted to the International Criminal Court in The Hague. The malnutrition is extreme. We know that the IPC has designated northern Gaza and Gaza City as a famine situation, but even in southern Gaza, it's got to stage 5 of the IPC acute malnutrition scoring system. And we saw many examples of patients who were dying as a result of the malnutrition. And of course, we're very familiar with the accusation laid 18 months ago by the United Nations official that starvation is being used as a method of war. And of course, this is the main charges upon which Netanyahu and Gallant have been charged by the International Criminal Court. We'll be very familiar with the effects of malnutrition. Of course, it's much worse than simply losing weight, particularly in the patients that I and other surgeons have seen. It makes it extremely difficult for these patients to recover from their severe injuries. Not only are they coming in profoundly malnourished and therefore being immunosuppressed, at risk of getting grave infectious complications, their wounds breaking down, their intestinal, their duodenal, their pancreatic, their liver repairs breaking down, causing appalling intra-abdominal sepsis and fistulae. But of course, we had no nutritional support to give them in the hospital. So they were malnourished to start with. We couldn't break that cycle because we had no nutrition to give them. And these are just some examples of patients who gave me permission to show their photographs. You can see the appalling weight loss, the complications with terrible intestinal fistulae. Several of these patients subsequently died because we couldn't treat them properly. This is Lama. This is a girl who gave me permission to use her photo when she died. Her parents gave me permission to use her photograph. She died under my care in May last year, just a few days after Tala, another 16-year-old girl, died under my care. They both had survivable but major intra-abdominal injuries from explosive injuries. They both were profoundly malnourished. They both died of terrible septic complications because of their malnutrition. They would have, their injuries, all things being equal, they would have had a greater than 95% chance of surviving. But they died because of the Israeli blockade of nutrition going into Gaza. Let me tell you about little Zainab. I spent quite a bit of time in my most recent trip on the intensive care unit at Nasser Hospital because I had children I'd operated on. she wasn't my patient, but I used to visit her and her mother. Her mother was too malnourished to breastfeed. Zainab died when she was 7 months old, 2 weeks into my most recent trip to Gaza. As you can see, she's got a nasogastric tube there, but she was being fed with 10% dextrose, little more than sugar water, because there was no formula feed. On the right is a picture of what she needed. She needed formula feed to save her life, but in Nasser Hospital, when I was there, we had no formula feed. We had no nutrition to give some of these children. 4 days before she died, some American doctors came into Nasser Hospital. They came into Gaza, and in their luggage, they brought formula feed, which they knew was needed because of the shortage. And that formula feed, every single can of formula feed was taken out of their luggage by the Israeli border guards and confiscated. Nothing else, just the formula feed. That is a formula feed that could have saved this little girl's life, but deliberately taken out by the Israeli border guards. I'm going to finish up by talking a little bit about the obscenely named Gaza Humanitarian Foundation, because shootings that took place at these food distribution sites by the Israeli soldiers and by the contractors formed a large part of my workload in my most recent trip. On the right is a young teenage boy who was shot in the abdomen and the liver when he was getting food for his family. And my 4 weeks when I was there most recently, we saw multiple examples of young teenage males who were deliberately being shot, predominantly by Israeli soldiers, at the Gaza humanitarian food distribution points. And what was even more distressing was that we identified a very clear pattern of injuries. I first heard about this on my 3rd day when I was operating on a 12-year-old boy who had been shot at a Gaza Humanitarian Foundation site. He died on the operating table because his injuries were so severe. And the surgeons I was operating with were telling me about the clustering of injuries they had identified. That one day there were 19 young teenage boys brought in who had been shot exclusively in the head and neck. Another day, and I began to notice this with the injuries I was operating on, the next day they all came in with abdominal gunshot wounds, the next day chest, the next day limbs. On one day, at the end of my 3rd week there, we had several individuals, several young teenage boys, all of whom had been shot in the testicles, nowhere else, just the testicles. And the clustering of injuries, the pattern of injuries was so striking that it was beyond coincidence. And we felt the only explanation was that the Israeli military were playing a game of target practice. The excess deaths, I mentioned this earlier, 350,000 people with chronic diseases. I'm a cancer surgeon back home in Oxford. I've been helping through MAP develop some of the cancer surgical services over recent years. We know there's any one time about 10,000 patients with cancer. We know that about 2,000, if not more, are diagnosed each year. We don't know what's been diagnosed, if any, in the last 2 years, but of course there will be many, many thousands of people with cancer. The Lancet, you'll be familiar, that a year ago estimated there were 186,000 people who died of excess deaths in Gaza. They upgraded that number last December to 220,000. Their latest estimate is there's more than 350,000 people in Gaza who died of excess deaths. That is more than 15% of the population of Gaza who have effectively been killed by this massive Israeli military assault. And of course, Gaza has been failed. It's been failed by my government and by your government and by many other Western governments. It's been failed by our media. It's been failed by our academic and medical institutions. And I believe, and I'm sure all of us believe, that we all as medical professionals and medical institutions, have a fundamental ethical obligation to uphold human rights, to protect lives and to condemn acts of violence. And certainly in my country, my medical institutions have failed. They have been silent and in my view have been complicit in this genocide. The BMA, the British Medical Association, has latterly come good. They've now voted to suspend engagement with the Israeli Medical Association. But the front page of the Lancet just this week has an article entitled "Gaza's Healthicide: Medical Societies Must Not Stay Silent." And you can look at the front page. It says that most medical and surgical societies worldwide have remained silent or issued vague statements about Gaza's healthicide. Staying silent whilst pretending to be neutral is, in effect, a form of complicity. And I hope all of us would agree with that. I'm going to leave it there and I will stop sharing my screen, but I'm very happy to discuss and take any questions.
Thank you. Thank you. That was profound, very powerful, and very damning evidence against the perpetrators of this genocide from the medical standpoint. Thank you for this hard work. This is very important. And I know as you said, the medical community, the medical journals, the mainstream media have played an important role in enabling this genocide and silencing the voices, especially the medical voices in our community that has been speaking against this. We just start seeing articles like this 2 years into the genocide, and they're still try their best to censor them. I think last week we talked to Dr. Feroz. I'm sure you know him too, and they did publish an important article. But even now, 2 years into the genocide, that medical journal refused to allow them to use the term genocide, even in quote marks. So the silence continues, the silencing continues. But with this powerful evidence, we have to keep pushing, and we're really grateful for you and for your colleagues and people like you who are pushing this. We're going to break that wall, and eventually we're going to force all of them to admit, because the evidence is overwhelming, the evidence is damning. I'm going to open to the panelists here, and especially for Dr. Swiyang, your colleague, your friend for decades, to discuss with you. If anyone from the panelists also have any questions for Dr. Maynard, please feel free. Dr. Swi, are you there?
Yes, I'm here. Nick, that is the most well put together lecture I've heard over the 2 years. I'm so incredibly indebted to you. You know, the way you come across, you know, without fear or fervor, direct, precise. And I think we have to, I tell you what, Dr. Nja, this lecture of Nick, we all should see it again and again. Can you make it available?
It's a small part of a much bigger lecture I give.
No, don't want
Swi,
to make bigger. I just want it like that, so that's easy
Yeah.
to explain to everybody. If you make too long, people switch off, you see. I'm talking about medical students, trainees, colleagues who are skeptical, that kind of thing, okay?
Yeah, very
It's
happy.
very powerful, and people have been asking for it in the chat.
Yeah.
And actually, if you don't mind, whenever you're available next week or the week after, we want to hear the full lecture
The
too.
full
If
lecture.
you don't
Yeah,
mind.
we can hear it, but let's start.
Anytime you like. Start with this one.
Thank you, Nick. Thank you so much. I also want to tell everybody, Nick is now the chair of trustee of Medical Aid for Palestinians. This is such a brilliant thing. Okay. Thank you, Nick, for taking on the job.
Oh, thank you. See, well, I've been inspired by you.
I
You
don't
founded
know.
MAP, and I think what you've done over the few decades is utterly remarkable. So, you know, you're
For
an
me,
inspiration to all of us.
the Palestinians. We all do our little bit, you know, and then we'll make it happen. Okay. Together we'll make it happen.
Exactly.
Yeah.
Any other questions from the panelists for Dr. Maynard?
I think we're all overwhelmed.
Yeah, we want to hear it again. We want to hear the full version, honestly, to digest it more. This was
Yeah.
just, just getting us on board.
Yes.
And I mean, maybe there are some good, happy news to share that the GHF, the the death trap GHF that was set up by
Yeah.
America, has been shut down, especially in the Netzarim corridor. I'm not sure about the ones in the south, but that is good news. This is, in a way, they are admitting their mistake and their crime, but we should not let them off the hook. And anyone who was part of this criminal setup, death traps, luring the victims, the starved children to be killed, anyone who was part of this should be held accountable. And again, when we say held accountable, we don't say this out of vengeance, although they deserve it. We don't say this out of punishment, although they deserve it. We say this because as healthcare workers, we want to prevent further genocide. We want to prevent further crimes. And holding the perpetrators accountable is one of the main ways to make a lesson of them and make other would-be perpetrators think 100 times before they participate in these criminal conducts. Thank you, Dr. Maynard. We are proud of you. We're proud of Dr. Khan. We're Dr. Swiyang and all of our colleagues. Actually, we just got a request and a question here that we want to create kind of a listserv or I don't know what you call it, list of all the doctors and healthcare workers who are against genocide, because the people, there are a lot of people who don't want to go to pro-genocide doctors anymore. They don't want to go to institutions that, are silent, have been silent on the genocide, and they do want to choose their institutions, their healthcare workers who are conscious and to represent the true meaning of medicine, who have been anti-genocide. So hopefully this is a project that we can all work on, creating a list everywhere by city, by state, by country, of all the doctors, the healthcare workers who have been against this all along and refuse to be complicit in these crimes. And also, we want to build this movement in the medical community and replace the institutions that failed us, whether in, the American Medical Association, the Canadian Medical Association, all the major associations in the West. We know the British Medical Association lately have been having some good, points, but it's still too little, too late, and we need to create a medical community that can be mobilized immediately whenever there's any community at risk of these war crimes, to mobilize immediately to exert pressure that is much stronger than what we have.
Yeah, Nidal, I just
Go ahead. If you can just mute for a minute after Karama, then we'll have you start.
a lot of the questions are coming in the chat. Why are the medical associations not working? Why our colleagues are not working? There is a number of reasons for this. However, what we are hoping that we are providing a platform for everyone to be against genocide and to have the material and to have the language and to have the knowledge to be able to speak up without fear of any consequences, because we always say that being anti-genocide is the core of medicine. And, we on the panel, we have Dr. Amy Hagopian, who has been removed from her positions at, what is it? The American Public Health Association. Her membership was removed because of her advocacy. There is a campaign against this position that is taken by the American Public Health Association, and hopefully we can hear from her at some point, so when she can tell us about her story. But Doctors Against Genocide is a space for us all to be advocates against genocide, war crimes, crimes against humanity, and do it effectively by influencing policy, influencing public opinion, and creating pressure. So this is our mission, and we are happy that you are all on the webinar with us, and please spread the word. Nidal?
Yeah, do you want Dr. Hagopian to start now or start with the
I have not heard from her if she wants to talk.
She's on the panel
I'm
now.
here.
Amy, do you want
Yeah,
to?
go
do you
ahead. Yeah,
want?
share your story, please. We want to hear from it. Then we want to go to our colleagues in Gaza before it becomes too late for them.
I will just make this very brief. I have been with the American Public Health Association for many years, and this year I was elected International Health Section Chair, and our section has been working for at least 15 years to persuade APHA's Governing Council to adopt a statement on the oppression of Palestinian people imposed by the occupation. We have never been successful until 2023, ironically, in November, when we passed a one-sentence resolution calling for a ceasefire. This was prompted by so many young people who came to the Governing Council meeting and stood in the back of the room and held a big banner saying, "Ceasefire now." Beautiful, beautiful young people, many, many of them. And it was very persuasive to the members of the Governing Council who, under duress, they didn't want to discuss this, but eventually it came to the floor and they passed this one-sentence resolution by 90%. So we can move our organizations, but last year, the 2024 meeting, we were prohibited from passing a replacement resolution, which is required when you pass a late breaker. And many of us put on red gloves and walked out of the room in protest. And for that demonstration, I alone have been singled out to be punished for this. I've been removed from my membership. My registration for the annual meeting is canceled. I cannot even go into the sessions. And I've been removed from my elected position as chair of the International Health Section. And this is because I am anti-Semitic. That is the claim. These claims were made by anonymous people who caused no investigation to occur, but some summary decision was made and I'm now excluded. I don't want to take more of your time, but I did put in the chat or in the Q&A a link to my petition, which we have put together, where you can read all the details, including the original documents in the case. Thank you for your time.
Thank you, Dr. Hagopian. And yes, thank you for sharing this. And thank you for being on the right side of history. And we are happy to support you in any way we can. Please, let's stay in touch. We need, please, this is an invitation to everyone to amplify Dr. Hagopian petition and to make sure that they are the ones who should be removed, not her. Going forward, everyone who's complicit in the genocide should be scared for their position, for their license, not the ones who are speaking up against the genocide. The people in Gaza and Sudan and Congo did not sacrifice all this just to be normalized and just for those who enable these crimes to get away without nothing. There should be accountability, and when we say accountability, we mean these institutions too, and they are the one who should be held accountable. And we need to join forces, all of us, the people who are on the side of the victims, to become stronger and for us to become the ones who sanction them, not the other way around. Any institution, any organization, any association, any provider should face consequences for enabling the mass slaughter of children, women, men, patients, doctors, nurses, and for not standing up with their colleagues. Thank you, Dr. Hagopian. We're going to go now to Gaza from our colleague, Dr. Iyad Amawi, to give us updates on what's the situation on now. It is a little bit late there, so we're going to give them the opportunity. Iyad, أهلا وسهلا. And do you have your son here with you?
اهلا وسهلا اهلا وسهلا طبعا يعني اول شيء
What's your son's name? شو اسم ابنك؟
هذا ثالث ولد هذا الله يخليك محمد. His name
محمد.
is
أهلا وسهلا محمد. And please, everyone, congratulate Iyad Amawi for being able to finally go back to his home.
علامة النصر.
He was one of the many people in Gaza who have been forcibly displaced, but he managed to go back to his home yesterday. أهلين محمد. الحمد لله على
كيف حالك
السلامة.
دكتور نضال؟ يقول الله يسلمك.
Congratulations for the
حالك
ceasefire.
دكتور نضال الله يسلمك.
الله يخليك حبيبي، أهلا وسهلا.
ارفع يدك وسلم عليهم. He is the third son. He entering the genocide when he was 7, and now he is 9 years old.
محمد مبسوط
تفضل.
أنت اليوم؟
تفضل.
مبسوط؟ طب ليش مبسوط؟ محمد saying he's happy now. Why are you happy?
عشان خلصت الحرب.
Because of the ceasefire. خلصت الحرب.
وكيف انت كيف مبسوط؟
الحمد
لله. قول ايوه.
الحمد لله.
الحمد لله، الحمد لله على السلامة.
الله يسلمك يا دكتور نضال. محمد طبعا من الناس هو وكمان الأطفال اللي كانوا في البيت نازحين نجوا 3 مرات من القصف خلال الحرب. كان حواليهم الشظايا والزجاج والجدران. He escaped under the fire يعني الحمد لله.
Were you scared؟ كنت خايف خلال الحرب يا محمد؟ كنت تخاف من الحرب؟ He was scared.
كثير كنت خايف.
كثير كان.
He was scared.
Scared.
Inshallah, it's up to all of us to make sure that you don't have to go through this again. No child in the world, no civilian, no human being should go through this, and it is
كنا نخاف من الكويت
for all of us to do
كنا
so.
نخاف من الكويت كابتر
هو
والأباتشي.
They used to be scared from the quadcopters and the Apaches.
They have a bad experience, Dr. Nidal, as other children. The quadcopter was investigate every window in the displacement homes around us and check every window. So they witnessed this bad experience from their childhood until the last days before the ceasefire was implemented.
كانت تيجي الكويت على الشبابيك.
It's a very huge
people through the windows. Anyone showing there, they used to shoot them, whether they're a child or anyone else. So that's very traumatic. Very traumatic experience for a child. Okay, yeah, go ahead. Tell us what's the situation there, please.
Yeah, firstly, thank you so much for your interest and for your continuity, my colleagues, all of you, and our new guest, Dr. Nick, Dr. Aziz. I met with Dr. Nick in Gaza under the bombardment when was a huge bombardment around Deir al-Balah town, and he served in Al-Aqsa Hospital for more than 1 month, and he returned a lot of time in Gaza. And I met him. He is a very nice man and very active, mashallah alayh. The situation here, my colleagues, is still ongoing catastrophe. Even though the ceasefire is implemented, but nothing change in AIDS distribution or shelters or tents. We have received a lot of promises that we will grant the permission for the UN agencies to entering trucks and tents. But in my thoughts, they will not grant the real permission up to tomorrow morning after they transfer the captives or prisoners from their side and the Palestinian side. So they suspend the implementation for the entering trucks up to tomorrow. So we must wait until tomorrow to see what will happen for the aid and the trucks. But the situation is going catastrophe in Gaza town. When my people went there, and I talked to a lot of my colleagues there, completely destroyed the northeast part of the Gaza city and the east part of the Gaza city. Everything's there's changed. I mentioned yesterday, we lose everything, but we remain over our land. We have a resilience to continue, but we need the world support, real support, tangible support. When we talk about the bulldozers and the huge machinery, just for opening roads and alternative routes to facilitate the lives, no one can imagine the amount of rebels spread in everywhere. I talked at this early morning to the Gaza City municipality head. He mentioned to me more than 85 for their huge machinery is completely destroyed. And he have a sewage water in every place in Gaza City. So when the people need to establish or set up new camps in that regions, they have any chance to set up with the safety without infectious environment there. So really, when we talk about prioritizing things here, we mean the first thing, repairing the sewage network and providing fuels to the desalination and pumps for the municipalities. And the second thing, entering without limitation shelters, tents, mobile homes to save our people dignity. No one can imagine when you return from your displacement, from the death trip, to your town or your village or your camp without any basic needs. I don't know when they will resume their partial normal life. So I know they manage the famine with another site by delaying entering trucks and nutritious food to this moment. The price also slightly decreased, but it's still higher than our ability. Our people here still dealing with the shadow economy, but maybe maybe in the next days they will enhance the ability for the Ministry of Economy and push the systems to be implemented soon in the market with the merchants, with all of the economic cycle here. But in my thought, we need sometimes to recover from this catastrophe step by step. But in my observation, we need to implement urgent humanitarian corridor to save, to rescue peoples, because the displacement people from the Gaza city, especially the center and the east part, they really return to and discover the catastrophe there. They completely destroyed their homes by the explosive robotics. It's not like the previous ceasefire when they evacuate their homes and returned. Nowadays, our people think very well where we will go. There is no safe place. And you can touch something very important, Dr. Nidal. When we talk about the Shati camp, a Shati camp completely destroyed their homes, and the camps there also by captors and burned bombs. They burns every tent remains there before the implementation of ceasefire to prevent any recovery of the normal life. So they use every chance to increase the suffering, to take a long time when we need to recover, to put barriers, difficulties in the road, in the blocks, to prevent the recovery from the NGOs and all of the international community. So we need to increase the pressure, awareness about it's not the problem. The ceasefire is implemented. Okay, it's a better situation now. We sleep without bombardment, without quadcopters, without hearing a huge bombardment, but it's not enough. We need to increase the pressure over those to entering trucks and to entering nutritious food and tents, and to help our people to recover their partial normal life. Even though it was still mentioned in the media from the political sides, up to this moment, nothing tangible changed here. So I received hundreds of human appeals from my people in Gaza City especially. They need to stop the catastrophe that caused the pollution for the environment, pollution for the water, and the lack of the sweet water, especially in the center of the Gaza city. The Gaza municipality sent a human appeal at this evening. They need the help from all of the NGOs and international NGOs, to provide them with the sweet water from out of the Gaza, from the trucks entering Gaza. The sweet water is very bad situation here in Gaza after they completely destroy the pipes. You know, Dr. Nidal, when they exploded a robotic by 2 tons of high explosive material, they caused harms for underground instructions and pipes, and all of the things under the ground is completely destroyed. So it's not just the appearance, the destruction over the earth surface, also under the ground, they destroy the life. So this is the two main photo for the scene here that must be touched from our colleagues in all of the world. So when they mentioned and celebrate by the ceasefire, okay, it's very great, and we will celebrate and sign agreement. But in reality, they destroyed the life all on the surface of the land and under the surface. So when we talk about rebuilding Gaza, we talk about rebuilding Gaza from the roots, not to the upper surface just and rebuilding buildings or towers or infrastructure. Just everything he needs to be rebuilt, but especially psychological, material, physically, everything's here. So when we put the plan, I mentioned that our priorities to save the dignity for the people here in Gaza and to save children and to accelerate the medical evacuation for the children. In our statistics locally here, we have 5,000 of children still suffering from amputations, from bad injuries, and they need to be medically evacuated. Until that moment when they grant the permission for the field hospitals or medical missions to come in with affordable numbers of doctors and nurses, it's a long time in my thoughts. So we need to accelerate the evacuation medically for those children, to recover them, to rehabilitate them, to facilitate their life, to support them psychologically. Because when we need to support our people psychologically, the main things we need to rebuild their life partially and push the hope again from their windows, and to see all of the international community support their reality over the ground. I talked to the previous webinar with the different organizations. They're just talking now about how we can manage and when we will manage. Okay, it's very fine, but we need to accelerate the mechanism and change our concerns. There's no time to still waiting the old preparation and old mechanism to push the aids into the Gaza. We need to achieve all of the people here in Gaza directly with the urgent needs, with the foods, with the tents. After that, we can talk about the next step, about rebuild hospitals, rebuild schools. It's all of the things is very important, but we can prioritize the needs for the civilians here after they completely destroyed Gaza. Khan Yunis municipality, I talked to Dr. Batta, he's the head of the municipality. He mentioned to me and to the media, they destroyed more than 85% of the Khan Yunis governance. It's a huge governance in Gaza, and no one can touch the reality there. When they destroyed Khan Yunis more than one time, they repeated destruction for up to 5 times within the genocide to ensure that completely the life there will not be resumed. And when we asked ourselves and all of the experienced people about why they return encouraged the Gaza city more than one time, east and north, the answer is very clear for us as a human being here. They need to ensure they destroy every life sign, every symbols of Gaza, every tower, every road, every municipality, the machinery of the municipalities, all of the things completely destroyed. And they targeted paramedics and cars, everything, to prevent the recovery for our life for a long time. So when we talk about entering trucks with the facilitation and just increase the number of our aids, it's not real making any changes here over the ground. This is not easy to recognize the reality after they destroyed Gaza. We need to open more than 10 humanitarian corridors directly from the border fence road up to the west region for Gaza Strip to save people. And we must set up new camps in the evacuated regions. Our people here need to recover their social fabric with their neighborhoods, with their neighbors, with their relatives whose remains alive there, because all of our people here, we lived here as a big family. So when we talk about anyone displaced to the south, and he hoped a lot of time to return to his town, to his village, because he know the people there. He need to recover his social fabric again and again, to be patient, to have nice feelings with, and they have a solidarity between themselves. They know each other very well, and so we need to push this to help people to recover by our knowledge, not the Israeli knowledge. When they destroyed and leave the rebels in Gaza City and the north, they need to prevent returning for our displaced people, and to set up new camps there and just push us to the western region. When they destroyed Rafah, they removed the rebel by the special Israeli company, and they leveling the land there completely, because they planned before the ceasefire to establish a huge prison there, or jailed us in that region, and to deal us with by the GHF distribution centers. When they failed, and they discovered there's no one can deal with those evils, they create another way and push more than 300 explosive robots in the Gaza city and destroy all of the Gaza symbols, towers, roads. Because you don't need to deal with us by this way. We will create more destruction, and we will let you lose your hope, final hope. The Gaza city is maybe meet 1 million people in their apartments and their towers. So in the previous ceasefire, we hope it's lasting more, because when we return to Gaza city, we have huge towers, numbers, apartments, roads, that we can resume our life again and again. But by this level of destruction, I think we need all of the world helps, just for reopening roads and removing rebels and resuming the life here. So the catastrophe is immense. We need to be aware about what's still happening, going here over the ground, and accelerate and push the aids directly, without any discrimination, without any bad mechanism that need to investigate every paper, every piece of the aids. There is no time. Our people are still waiting, all of the international community help, and we must pass the barriers that the Israeli put on our roads, and prevent the UN. In my last statement, the UN is the a better solution, with the cooperation with others, to manage this situation. And as they mentioned politically and local sources, they will push a huge machinery, cranes, bulldozers within the next few hours. So I hope that will happen. And after that, we can putting the plans urgently to do interventions with others to help our peoples. I hope I transfer the reality here, and I'm ready for any questions, my colleagues. Thank you so much.
Thank you, Iyad. Thank you. Yeah, we're gonna get back with you, because I'm sure we have more question about the everyday details, and we know we're all having shared the relief that the direct killing is over, but we know that the reality is catastrophic, and people now are facing it. We know winter is coming, and we know Israel will do everything it can to make life for people miserable. And we know they will also use any excuse to go back to the killing and the bombing. That's why we in the medical community and all people of good conscience all over the world should be on the alert, should keep the pressure, and make sure that the Palestinian people, the people of Gaza, are the ones who are, controlling their rebuilding the way they see fit, and their voice is the one that is taking priority more than the real estate developers who are trying to make business out of this genocide and continue profiting from the genocide. So we'll go back and talk to you. I'm gonna go to Mundir now. He's also in from Beit Lahia. He was displaced. I don't know where is he now. Do you hear us, Monder?
Yeah, I can hear you very well, my brother.
Can you share with the
Good
video?
evening, everyone from Deir el-Balah. I'm still in the south of Gaza. I'm still not going back to my hometown, my lovely hometown, Beit Lahia.
حياك الله منذر، الحمد لله على سلامتك.
الحمد لله على السلامة
الله
Monder.
يسلمك أخوي، يعطيك ألف عافية.
Can you do
الله
the
يعافيك.
video or it's hard?
أنا ساكن في الخيمة والله، والخيمة معتمة ما في، بعدين 6% في الموبايل.
Okay.
خلاص خليني
He's
أحكي
still
هالكلمتين
in his
ويعطيكم
tent
ألف
and he
عافية.
he doesn't have a good connection and it's dark there. Yeah, تفضل Monder. Share
It's very
what you
dark.
can before you run out of power.
Thank you so much for giving me this opportunity to describe the situation. The war is over, but there is no guarantee that the war will come back again, because we don't know what will happen tomorrow or after tomorrow. As a citizen from north of Gaza, I'm still unable to go back because we are waiting for the process to release the hostages and release the prisoners, and we start in the stage number 2. So that is why we are still delaying until we get confirmation, and that will be at 6 a.m. tomorrow morning, to release the hostages, and we can decide later. So when you ask me where are you now, I'm still in Deir el-Balah in south of Gaza, and most of the people that is from the north are still waiting for that confirmation as well. Anything might happen, but there is no guarantee that the war will not return back. That's the reason many families as well, they are waiting for the second stage to be implemented, and hopefully this time it will works, implemented, or it can be complete for a long time. We are still suffering of lack of water, and we have some trucks coming to Gaza, but that's not enough, as we are 2 million people living in Gaza. So, and many of people are don't have any income. So that is in terms of food. We have food, but as I mentioned, most of the time there is no money to buy the food. And hopefully this time the United Nations can work to provide the food for free and to be distributed for families who don't have any income. In terms of safety in the people themselves, so hopefully that will not affect, as many families start to fight. And that's happened a few minutes ago. If you following the news that one of the famous journalists, his name is Saleh Jafarawi, he has been killed, not from Israel, even the war is finished. That is because families start to, I don't know how to express that in English, but I can say they start to fight each other. So it is like fight each other, not with Israel. No, we are not fighting with Israel, and we are start fight to each other. We don't want to talk about this a lot, but that's happened, and that is the local news, or that is trending news in Gaza, that Saleh Jafarawi killed, but not from Israel, that killed by Palestinians themselves.
Monder, we heard that he was killed by an Israeli armed gangs. Unfortunately, we know Israel withdrew, but they
دكتور
left a lot
نضال
of gangs.
دكتور نضال بعد إذن منذر بس يخلص. أنا عندي clarification. I have a clarification about the incidents that happened at this early morning today. Yeah, after he finished, inshallah.
Yes, Monder, yeah.
And my request, and that is my appeal, to get clean water and food for displaced to return back to their houses. There is no more house, actually, only north of Gaza, and the people who's also staying in Rafah and Khan Yunis. So that is my appeal to everyone who listen to us, that we really need your support in this. Even the war is over, but we still need your support, need your help to make the life acceptable in Gaza. And the most important thing at the moment, to open the border for us. And they mentioned that they will be open on Tuesday, but there is no confirmation and there is no guarantee. And they're gonna start with sick people and the people who has like files in the hospitals or something like that, and the number is very big. So hopefully that they can make the process more faster. And everything now, we are all the eyes for us as a Palestinian, and the people who is living in Gaza, the 2 million people, are waiting for the news starting from tomorrow. And every minute count at the moment. Alhamdulillah, there is no killing people, but every minute count on what is the news, where is the hostages, or when they're gonna release the hostages, and where and how many hostages left, or is it gonna be working tomorrow in the morning or not. In the same time, Netanyahu will be honest this time to complete his promise to release the hostages, because he gonna release 1,700 hostages. And my family and other families are waiting for Palestinian hostages that will be released in the evening time. So we are waiting, and anything might happen. Hopefully this time will be a successful release, and the ceasefire will complete, and the war, we don't want any more war. We just want to survive, and hopefully we can return back to our hometown, and everyone who he can return back to where he live at the moment.
So, yeah,
So
Munir,
that is the situation, my
Munir,
brother.
last week you were able to distribute some food parcels and vegetables to the camp where you are, and then a few days ago you also when was that? Yesterday you got them fresh, clean water.
That was today in the
Today?
morning,
Oh yeah,
early
you
morning.
can
Yeah,
share the video
the
of
people
that.
in Beit Lahia, yeah, you can share that. No worries, you can share.
So tell us, how did you manage to get this water, please?
There are so many water stations here, and in south of Gaza, the water station is still working, so we can who has like a tank. So the cost around 1,000 new Israeli shekel, around $300. And for that we can get like 5,000 liter, and that will be enough for 200 families. So we can help them to get fresh water and clean water. It is filtered water, as the water that we are using here, it is salty water. So that is my appeal. That's why I'm giving you a call today, and I make sure that my request and my appeal, whether on myself, on any other organization who can help. And I just got an appeal from my brother. He needs 2 tanks of water, because some of the families, for example, brother Iyad, he returned back to Gaza City, and there is some families already returned back to Beit Lahia in the north of Gaza. But we request to get 2 tanks of clean water as urgently, and should be tomorrow. Actually, he said if possible to request 2 tanks of clean water, and that is my request. If there is anybody, whether through me or through anybody else, who can help us to get 2 tanks of water, or maybe a big one that can reach to Beit Lahia. And that is my message. It is only my message that
Yes, Munir, before we forget, please work on it. Try to get that tank to your brother in the north immediately. We'll take care of it. And if you need help from Iyad also.
دكتور نضال، بكره في
تفضل.
غزه منذر، بكره في غزه في ان الفريق موجود غاد. كلمني، وبكره بشوف مين الشحنيات تبعات الميه تبعات المؤسسه اللي اشتغلنا معاكم معاها قبل هيك، وانا بخليهم يصلوك. بس حدد لي العنوان والتفاصيل بكره وقديش الاحتياج واعتبره عندك.
خلص.
توكلنا على الله.
Let's make it
تماما.
happen.
إن شاء
Let's
الله.
make it happen
تمام.
inshallah tomorrow.
Let's make it happen inshallah.
So again,
So,
what just to emphasize what Mander said, that people need and a huge need and urgent need for clean water, for food, for shelter, all the urgent needs, the basic needs for medications. The hospital are in a huge need. Small initiatives, small organizations like us and many other organizations. We have Jihan with us also, she's been running soup kitchens, 2 or 3 or 4 of them in the last few months. These are all important. We all need to do as much as we can, but that is not an alternative for full opening of the borders, all the borders, and allowing the UN and the international community to enter large-scale aid, unfettered aid, food, medical supply, clean water, and everything. So we will do as much as we can ourselves until the international community steps up and do what they need to do. These are 2 million people who have been, enduring a genocide for 2 years. All their civilian infrastructure has been destroyed, and they need the help. The sooner, the better. And we all know winter is coming. As Munder said, the families who managed to go back to Gaza or to the north of Gaza found their homes to be completely destroyed. There is no water, there is no food. Of course, there is no farming, there is no jobs, they have no money. Munder just mentioned that a water tank like this in his area costs about $300. For us here in the United States, $300 is not a lot. But for the people of Gaza who have no penny, that is a lot of money. So they need our help. Please share the call for everyone who can help, can donate to us or any other organization that's doing the job. We have Jihan here. We're working with Munder, with Iyad, with many other people on the ground to help as much as we can. We know it's a drop in the bucket, but it is a drop that counts and that helps even few people until hopefully we can get more aid from the international community. Do you want to put the voice of the video, Karama? Is there a voice?
دكتور نضال بعد إذن دكتورة كرامة.
تفضل.
I have just a clarification for the Munder's speech about the fightings between gangs and the Palestinian people here. To be clear for you, this is my daughter Razan. She's 13 years old.
هلا رزان، كيف حالك عمو؟
يلا.
I am fine, alhamdulillah.
Do you speak English, Razan?
Yeah.
Yes.
How good is your
قال
English? Tell me. Come on.
Yeah, come on. نتكلم.
ماشي.
عارف عن نفسك بالإنجليزي.
My name is Razan. I am eating that يعني أنا في الصف الثامن وعمري 13 سنة.
I'm in the 8th grade. I'm 13 years old. Okay.
أنا بحب هواية الرسم، والحمد لله إن هذه الحرب خلصت ورجعنا لحياتنا، لأنه كنا عايشين في مجزرة وإبادة وشلال من الدم اللي ما كانش يقف، وعشنا أيام جوع، وكنا نعيش على العدس، وكنا مقطوعين المية، ودايما يعني ما نلاقيش
Let me translate. So Razan loves art, loves school, and she misses her school. Do you miss your school?
Yes, I went to school. أنا بحب أتعلم وإني يعني أصير متعلمة وأكبر وأشوف مستقبلي وأصير زي الأطفال اللي في العالم، إني أتعلم ويصير عندي يعني أتعلم ويصير عندي هوايتي، يعني أمارس هوايتي بشكل طبيعي من دون قصف ودمار وحرب وشلال الدماء ومن دون جوع، وكنا مقطوعين الأكل وما نلاقوهوش، وإذا لقيناه نلاقيه بأسعار غالية يعني ما نقدرش عليها، وغير النزوح، ويعني كنا عايشين بتعب وإرهاق ومجاعة، وما كناش نقف عن هذه الإبادة، والحمد لله والنفسية
So,
تعبت حتى
Razan,
والحمد لله إنه هذه
yeah,
خلصت الحرب.
Razan and all of the children of Gaza are sick of the genocide, sick of the killing, sick of the lack of food and water, and sick of the lack of education. She wants to be like any other child in the world, to go to school and to excel at school and to have a future and to be educated and to have a life where she feels safe and peaceful and find all the necessities of life like all the children in the world. Iyad, translate for your daughter. I cannot keep up with her. She's too smart, too fast for me. Please finish what I missed.
الله يخليك الله يخليك يا دكتور نضال. Razan is my first son. She is my daughter, only daughter, and I have 3 sons. Subhanallah, she's very nice when she describing everything and have a nice smile, even thought what's still happening in the genocide. And she mentioned a lot of jokes within the war. And when she touched and see the quadcopter, she said, "Oh, our life ended." And all of my son become laughing.
Yeah.
Yeah, but she talked about the suffering, about her hope to complete the life normally without pressure, psychologically, but without genocide killings. My sons witnessed the martyrs of the sons of their cousins in this war. Completely, they martyred, and she lost her nearest friend, Sarah. She's martyred. Yeah, she martyred, and
Sorry for
she
your loss,
went.
Razan.
يا بقول لك تعزينا لك عظم الله اجرك
عظم الله أجرك.
ان شاء الله. ف
Allah.
yeah, she talked about her experience about the genocide and how we hope they will pass this after the ceasefire is implemented. All of our children hopes this lasting forever and we will not return to the genocide again. And inshallah, she mentioned she hoped to be a famous drawer. She's drawing me and all of the things around here very well, and she's select a color very well, mashallah. And
Can you share
I
some
hope,
of your art with us next week, Razan?
of
If you don't
course,
have
yeah,
it now, next week. We want to see some of your art, please.
yeah, I will let her draw you, Dr. Nidar, and anyone.
No,
from my
not me,
colleagues.
please. No, I don't want myself. I want to
حبيبنا
hide. I want to hide myself.
حبيبنا يا دكتور نضال يسعدك. ان شاء الله.
Can you draw Dr. Hussam Abu Safiya?
يا بدنا اياك ترسم الدكتور حسام ابو صفيه. تعرف تمام؟
تمام ماشي أعرف
We're
أوكي.
waiting for the drawing next week.
Okay.
اوكي.
حبيبة الشعب. حبيبتي
حبيبتي
ما شاء الله عنك. الله يحميك.
الله
God,
يحفظك.
God bless, God protect you.
ان شاء الله.
That's why
So,
we actually, I mean, we love it whenever there is children here because, I mean, the least we can do as adult, as a medical community, is to protect the children. The children did not commit any crime. They should not be punished. All children of the world should feel safe, should have a good life, and it is the least as adults that we should ensure and work our hardest to make sure that every child in the world is safe and happy and peaceful and has the basics of life and education guaranteed. And we're going to talk with our colleagues from Congo now, and we will see that the systems of genocide, it's not just in Palestine, in Sudan, in Congo, everywhere else. It's a proof that we as adults have failed. But hopefully, with all your help, we're going to put an end to this and we're going to make the children of the world feel peace and safety again. Yeah, you have some comments, and I want Jihan to quickly comment on this before we move to our colleagues in Congo.
Officially, the local sources that related to the law enforcement forces here, they announced they will suspend the gangs that Israeli grant them permissions to make danger for their people and to prevent AIDS for a long time. So they, at this early morning, they announced they will punish those gangs. So the local resistance and the local law enforcement forces, they began a campaign against the gangs here locally. So maybe Dr. Munder, because he have a shortage in charge in his mobile, the reality over the ground in Gaza City especially, they attack against the groups of gangs and maybe shot a lot of them. Locally, they announced the local media sources. So we hear from time to time sound of bullets around the Gaza City. And also they did something like that yesterday night in Rafah against Yasser Abu Shabab gangs. So maybe from time to time, the local sources announce officially by the local groups here, they will suspend and they will punish those gangs because they increase the suffering and grant the shadow economy the opportunity to punish our people again and again. So they will cause some casualties around our civilians because, you know, it's a long time before they have a chance as a blue police here locally to work against these gangs and to suspend their inflation and their spread between our society, and they cause a lot of damages for the social fabric, and they spread drugs. So our locals here, they just demands law enforcement to take their rules again and again, to grant all the NGOs also the opportunity to work under the security covers and to facilitate their works better in the best situation that can meet our needs as NGOs and as aid workers here. So this is the situation.
Thank you, Iyad. I want our sister Jihan. She's also a journalist, and she also have information about this, more details. And also, we want to thank Jihan. Jihan, we lost you. We want to thank Jihan. She's the founder of Hayat Washington, a nonprofit organization. She's been working hard on the ground, and we have been working with them. They have been running a few soup kitchens all over Gaza for the last 2 years, and we can share some of the pictures and the videos after Jihan give us her explanation about the murder of the journalist. Ahlan wasahlan, Jihan, go ahead.
أهلا وسهلا. My name is Jihan Al-Husseini because my name is not writing, okay? From Gaza City, and Dr. Amawi, Dr. Iyad, على فكرة, my grandfather was the mayor of Gaza, Fahmi Al-Husseini. I always said that. Who built
ما شاء الله دكتورة
Gaza.
جيهان، يعني عائلة الحسيني عائلة مشهورة عندنا في غزة يعني،
لا بس
ومن أعيان القوم والله. الله
لا الله يخليك. بس I proud of him because he was a famous lawyer and he rebuilt Gaza after the World War. يعني yes, okay.
Yes.
I want to explain from you many issues about the north area. I heard from our team in Gaza that Beit Lahia, Jabalia, this area, Beit Hanun, it's not يعني it's very dangerous. We're not allowed for the to go back there. This is, and the other issue that we are worried about, because we should be with the donors to talk with our donors يعني the situation. We will continue our work for tequiyas, soup kitchen like this, or what you expect to the aid will come through Gaza. I heard about aid, and I heard about the merchants. The truck, they said the majority of truck is from merchants, not from aid. Could you please explain this issue and your need, the urgent need now, and for short term, for 3 months, or that's we need to hear from you, please. Thank you.
ممكن أتكلم دكتور نضال؟
تفضل.
دكتورة جيهان، أول شيء يعني أهلا وسهلا فيك. يعني
الله يخليك، أنا مش دكتورة، أنا مع ماجستير
يعني
دكتورة
يا ستي، وأنا دمي فلسطيني زي ما بقولوا. My blood is Palestinian. Yes, your clarification or your intervention is very excellent and true. Most of the trucks entering Gaza within the last 72 hours are just formations, and the little numbers for the NGOs or UN or WFP. So the real implementation for the ceasefire agreement is still suspended. I talk in my first brief. We still waiting the implementation after they trust and deliver the captives, maybe at early morning tomorrow. They mentioned at 6 a.m. or 9 p.m. After that, they will open 5 humanitarian corridor directly from the fence road to the all of the Gaza Strip from the north to the south, and also the Rafah and Karam Abu Salim cross point. So we will wait up tomorrow, and we will see the number of trucks. They promised us 600 trucks at the first wave. After that, we can estimate and we can manage what we will do in the next step. So this is all of the things, just monitoring the real implementations. You know, at the first time, we will face struggles from the Israeli side as they habit to do in the previous ceasefire. But we hope in this new agreement, everything's will change. We hope that.
Thank you.
We need to hear your needs. Yeah, I mean,
Yeah.
For us at the non-profit
Yeah.
and humanitarian work.
Yeah.
To
أخت جيهان
navigate us.
Yeah. I mentioned in my last brief about the first priority, the tents and shelters and maybe mobile homes. The second, the nutritious food. The third, accelerate the medical evacuation for injuries, especially children. The fourth, bulldozers and grains and huge machinery to reopen roads and alternative routes around us and to facilitate our life. The fifth needs to repair and fix the desalination waters, especially in Gaza town stations, and supplying and providing our people with the sweet water urgently from the outer resources, not depending over the underground waters, because it will take time and there is no ability and there is no machine that can digging and pull the water from the underground between these rubbles. So this is the main 5 priorities for us up to this time, and maybe will change with the next few days.
Can I read to you what I received from my, or the short, the summary, what I received from our team on the ground? They said that they need emergency huge for the priority for food, water, and he said what it's enter, even if they will respect the agreement, it's not enough, because he told me it's the need is very huge, because I told him I want to know about our work in the future. He told me even if a huge, what aid it's enter, he told me it's not enough. People need a huge supplies from food, water, and as you said, tents and ready homes. He said it's not, and people don't have enough money. He said 70% or more of the people, they don't have money to buy the things. And also he said that the majority of trucks enter Gaza, it's for merchant, not for from aid.
Yeah. Jihan, what you mentioned is right. I mentioned that before when we talk about the shadow economy. The Israeli grant the permission for the merchants to entering foods and goods and resell it multiple times. So they cause astronomical inflations in prices. When we need to decrease the prices now, we need a long time, and we need to push the aids by the UN agencies and other agencies to decrease the prices rapidly to help our people, because we are exhausted by the inflation of prices for a long time. And also the merchants, and up to this moment, they control the prices, even though they slightly decrease it, but in the general view, they still control our life. And also we have a bad merchants here and in West Bank who is sending the foods and goods to the local merchants here in Gaza. So the situation is complex. It's not easy to facilitate and to rapidly recover everything's normally. So as I mentioned, I sure about entering enough number of trucks from the NGOs and let the economical cycle reestablish its functioning again. The Palestinian banks and the Palestinian authorities, they promises tomorrow will reopen banks and they entering cashes. This is very important incident. If it's happened, I swear everything's here will change, because the economical cycle will resuming very well, and all of our people will have deals with the official paper, with the new cash, because all of our paper cash is scattered, nothing remains here. So this is the very critical point. They announced this today evening, and we're still waiting tomorrow. I have some paper I will assign with the bank tomorrow. If they grant me a permission to enter bank, I mean everything's will change tomorrow. So inshallah, we hope that everything's will return rapidly to the Gaza, and we will recover our life. But we will need time. I mean that.
Thank you, Dr. Iyad.
Jihan, we are sharing one of the videos that your group shared from Gaza for the soup kitchens with the support of Doctors Against Genocide. So thank you for the hard work. If we want to put the, I don't know if there is a sound or not.
And I wonder if you know that the merchants to enter the track through the Egyptian or through Karim Abu Salim, they pay for the government, pay for the Israel, or pay for the Egyptian, pay for the Jordanian. You know that?
Yeah, I know.
Exploitation at every level.
Jihan, they pay for the security company, and they pay for the merchants who is work as a mediator between the merchants here and the merchants in West Bank, and pay for sometimes for the gangs before the implementation of ceasefire to easiest road and to pass. So all of this cost put over our people's shoulders. So this is a very costly things. When they grant the permission for the merchants, they need to do that to increase, to manage the famine.
توزيع الطعام هنا في مخيم الزوايدة بدعم كريم من أطباء ضد الإبادة الجماعية بالتعاون مع حياة واشنطن.
Yeah. Is this working?
Yeah. This is the video you
frozen, but the voice is on.
So, دكتورة جيهان
الإبادة الجماعية بالشراكة مع حياة واشنطن. ليش حابب توجه رسالة للمبادرة نشكر المبادرة.
The voice is on, but the video is frozen.
نرجو منها باستمرارية العطاء، نشكر العاملين عليها، وإن شاء الله نضمن المزيد، لأنه الشعب الفلسطيني في حاجة لمساعدة وكل الجزائر، ونشكر الجميع على عطائهم وعلى تعاونهم. إجمالي بارك الله في الجميع.
Okay.
That's not a problem. يعني it's a very nice surprise. So, Jihan, this is the situation. It's very complex and it's ongoing over the ground. But in my thoughts, after the law enforcement and the Minister of Economic take their rules by the days, everything here will be managed and will be organized again.
Inshallah.
But we will take some time, inshallah. So we will continue, and everything here is completely changed. And the Egyptian side also, they send their trucks from the Egyptian committee, and we touch the increasing number of trucks for the tents from their side and some aids, but it's not enough because we need to implement the complete agreement and without any limitations, without any restrictions, without the list of the double usage materials. They prevented it for a long time. Inshallah, something good will happen, and we will follow and let you know the updates later, inshallah.
Inshallah. Thank you. Shukran.
Inshallah. You are welcome, inshallah.
Thank you, Iyad. Thank you, Jihan. Now we're going to move to our colleagues from Congo, Hadija and Claudia, to share updates on their campaign there. Hadija is with Let's Act Together. Are you there, Hadija?
Yes, I'm here.
Okay, if you want to turn on your camera, please. I don't know. I think we'll not hear from Elvis today. He might be busy, but we're happy to hear from you, Hadija. And our people from Sudan did not also show up. I know the situation is tough there. Hopefully they can show up soon. But Hadija, it's all yours. Share with us what do you have for the past week, please.
Salam everyone. My name is
Salam.
Hadija. I am an activist with Let's Act Together for Congo. First, I would like to share a message of condolences of the news that has the breaking news about journalist Saleh and his murder. As we were on the live stream, condolences from our team to you all, and we continue to bear witness in his honor, because he was killed because he bore witness for 2 straight years about the atrocities that were going on in Gaza. We thank the team at Doctors Against Genocide for extending their humanity to the Congolese cause. We received a grant a few weeks ago, and we have been working together with the communities on the ground in the eastern part of Congo, which has been undergoing genocide for the last 30 years for the purposes of resource extraction. Congo is a very mineral wealthy country, and the people there have been made to suffer. Millions of people have died, have been killed, and continue to suffer today because of capitalism, Zionism, imperialism, all the same ills, all the same evils that plague all of us. So last week, with the grant we received, we were able to go to a clinic in Goma in North Kivu province. Goma is a town that is currently rebel occupied. So the government has shut down a lot of the financial activities, a lot of the getting access to medical care is very difficult because the rebels who are occupying the town are trying to be in negotiation with the central government, and it's all the people as usual are stuck in between, and they suffer the most. So the team at Let's Act Together for Congo was able to go to a clinic called Afya Yetu, which means our health in Swahili, the local language. And we were able to deliver some much needed medical supplies and medicine for the people there. I believe our team member, Philippe, might be here. Philippe is the general manager at the medical center there. So that's what we did last week. And then just yesterday, we traveled deeper into the region, into the rural areas, and we were able to deliver medical supplies as well and some medication from
free Palestine! Free Palestine! Free Palestine!
What is this?
What do we have here?
Sharing their screen.
We have a pleasant surprise from Dr. Hadija.
Dia?
It's okay.
Dia Dawood, the guy on the flotilla, the doctor on the conscious flotilla, was abducted 2 days ago. He made it back to Florida this morning, and he's gonna come and join us, share his experience, and he's already in a protest there in Florida. But Dia, yeah,
But Hadija, could you please?
Go ahead, Khadija.
Wait.
Go ahead. Sorry.
Yeah.
Oh, okay. I'm
Yes,
just
go
going
ahead.
to finish up. If Philip is here, he can share about the medical mission that we just posted in collaboration with Dag on our Instagram. Philip was leading the medical mission because he's our healthcare provider on the ground. So if Philip is here, he can share about what we did in the clinic in the rural area.
I do not see him on the panel.
Okay, he might have not been able to make it, but we were able to go to a clinic in.
Could you share the video, Hadija?
Let me see. How can I do that? I'm not sure.
Share screen.
I'm on my phone. I'm not sure if
Oh,
I
okay.
know
share
that
it for you.
technology.
You
I'm
can
sorry.
do it on the phone.
We
I'm
can share
sorry.
it for you.
But yes, it's been collaborated with Dag on Instagram.
I can share it for you if you have it
This
on
is the one you
WhatsApp.
shared on the WhatsApp also, or it's a different one?
It's the one on WhatsApp that I just shared, yes.
Okay, I'll show it to you, Karam. It's there.
Share it with Mesa, please.
Mesa, okay, where's Mesa?
Here.
Okay, perfect.
I don't have Philippe email, Hadija.
I shared his contact and I told him about, he was here last week.
Yeah, I know, but how did he connect?
I think we brought him up. I don't think we have the email for him, but maybe we'll
Yeah.
do it next time. Yeah, I shared the video with you, Mesa. If you want to share it here, please.
If you give me his email, I'll add him, Hadija.
Okay, will do.
Mesa, are you there?
I'm here. I'm just waiting for it. I don't see it. Did you send it in the group?
Yeah,
The
WhatsApp.
Congo group.
No,
Oh,
I
okay.
sent it in the WhatsApp, our group.
Okay. Bear with me because it's updating. Okay, I got it. Okay.
Yeah.
Everyone, this is Agissons Ensemble in the Democratic Republic of Congo. We are in Majagi Center. This is in Masisi territory, North Kivu province, in DRC. We have come here with a set of medicines to support the center that has been affected greatly by the war that has recently been here in January. We came with a team of brothers and sisters, and we found here nurses and people who are sick. And we saw that they need a lot, but according to the means that you contributed, we managed to bring something. And we hope and believe for greater next time. Thanks.
Thank you. This looks great. I'm happy.
Yes, we are
I think
very,
what's the name of your organization again?
we are Let's Act Together for Congo.
No, the other word for it. What is it?
Oh, Agissons Ensemble. That's just French. It's French for Let's Act Together. Agissons
Yeah,
Ensemble.
what's the French? How do you say it in French again?
Agissons Ensemble.
Oh,
Impossible.
I'm bad with language, but I have to learn this.
But you know what? Fun fact: the word afia that's how we call health, and that's also health in Arabic. Afia.
Afia, yeah.
Yes. Right?
Yes.
Yes. So that's also our word for health, afia in Swahili, the local language in that region in Congo.
Oh,
So they call Afia?
Yes, it's health. So that's why Philip's there's the general manager of Afia Yetu, which means our health. So that's a nice connection that
Native languages.
that we have. Yes. So
Yeah.
we're so grateful as always to Doctors Against Genocide, and we continue this partnership. And we thank you for extending your humanity to us. And yes, as always,
We are one team, Hadija. This is the least
You.
we can do.
Keep up the good work. We'll stay working together, acting
Yes.
together,
Thank
and
So no
working
need to
together.
thank us. Thank you.
Thank you for showing up, Hadija. And I shared the link to support our relief efforts in Congo. So please donate generously. This is a very important initiative.
Wonderful. Thank you.
Claude is there? Claude?
Yes, I'm here. Let me turn on the camera. Let's see.
We can see you, Claude.
Yeah, it's working now.
Get that right. All right. Hello, everybody. Praising everybody. Thank you for all the work that you're doing. Very heartbreaking hearing about the atrocities still in Gaza. Our work is on the Congo focuses on the justice and accountability part of it, not so deep in the humanitarian work, but it's parallel to what is happening in Gaza. And for those that I haven't met yet, I am a Rwandan genocide survivor. Rwanda is one of the two main countries that are actively committing a genocide in the Congo. Rwanda and Uganda are doing that, supporting this, not supporting, but this rebel group, what is called the rebel group in the Congo, is actually an extension of the Rwandan and Ugandan armies committing these atrocities. And so our work is educate, but also the pursuit of justice and also advocacy. There are some parallels with what's happening with Gaza right now with signing of a deal. You know, that word deal keeps coming back. There is also a Congo deal that was signed in the summer. There is more deals to be signed that are being worked on, but a lot of those none of them actually take into account the people themselves, and there is no accountability built into those agreements. And our work currently is to engage in legal processes to pursue some of the starting with the low-hanging actors that are supplying and providing resources and money to these destructive groups in the Congo. We actually, as I've mentioned a couple of times, launched a Congo Justice Project that starting next month, we have a legal team that's going to be dedicated to digging into some of these low-hanging actions that we are going to take, and I'll be giving some updates on what happens, because some of the groups that we are dealing with that are funding, or any individuals that are funding some of these atrocities, are actually based here in the US, and there are legal precedents to deal with such. And what we're hoping is that eventually this will lead to some bigger, larger cases and potentially reparations for the victims. So we center victim testimony and reaching and finding people who are directly affected to contribute to these cases. That requires resources, sometimes to move them and keep them safe and feed them. We're also we incur costs to pay for the legal fees and things like that to pursue these cases. And so one way that you guys can help, and individually, and one way that we can help as a collective is also contributing financially to those efforts. We are currently doing it through our website, aglan.org, donate, and there is a section that says 6 million dead, no more. Other than that, we may potentially build in a campaign with Doctors Against Genocide, something to consider in the future. However, regardless, we appreciate the support. We appreciate you sharing the message, the work, and raising awareness on the ongoing genocide. I would like to quickly, though, just add a note of caution when these deals are signed. Sometimes they take this thing out of the advocacy work, because everybody says that there is a peace deal now. Why are you still, making noise? Why are you still advocating? Why are you still pushing for change? So I ask that we do not stop our work to advocate and to push. And that's a lesson learned from the peace deal signed in June. Actually had a previous discussion with Hadija on this. Sometimes these so-called peace deals get in the way of advocating and pushing for accountability. And there is no peace without justice. Peace is not the mere absence of war or conflict. It's the presence of justice. And I think, we continue to work hand in hand with everyone that's advocating for ending genocide and bringing accountability in Gaza, in Sudan, in Congo, and all over the world. So that is our update. It's that starting in November, we're actually, the legal team will start the work And right now we're just getting into the community and getting people in places where they can safely share testimonies and actually contribute to this effort.
Thank you so much,
Yeah.
Claude. Yeah, being anti-genocide, it does not mean just looking for a ceasefire or for a way that bombs stop. It's really restoring the rights of the community that is affected, making sure that the mechanism and the circumstances that led to the genocide end immediately, and working on the well-being of the survivors and not adapt to the demands of the perpetrators. And we're seeing this right now in Gaza, where, everything is appeasing. The Israelis are trying to make them feel comfortable or wherever it is. Even the American team that negotiated the deal is there in Israel celebrating with them. It's really incomprehensible. But that, as you said, advocacy just started. It never ends until there is no system of genocide that is operational.
And Karame, I'm looking forward to seeing you guys whenever we can make it work in Boston.
Yes, of course.
Yeah,
We look
yeah.
forward to having you, Claude.
Yeah, yeah.
Good. Where's Ndal?
Yeah, I'm here. I think we lost Dia. Dia was supposed to come next, and we're still waiting on our colleagues from Sudan. But
It looks like I was just in touch with Zainab, and she cannot make it, but
that's fine. Yeah.
But the situation in Al Fasher is extremely difficult. We are hearing from our colleagues in Sudan. It's very scary, and it's we just heard that they bombed a hospital, they bombed a school. The Al Fasher area has been under siege for over 500 days, and the attacks on civilians are intensifying. It is in some news, it's not covered by far, is not covered enough. And the death toll and on the population is extreme. Like I think today, Al Fasher Mosque and hospital attacks left at least 20 people dead. So it is, our eyes are on Sudan, and we are trying to understand the situation from the source and get more involved in helping, inshallah. And same thing, drones and quadcopters and attacking hospitals and attacking schools.
And cutting the internet and the communication, so it's very hard for them to make it. Hopefully, they will be able to join us next week if they could not join today. Again, Dr. Dia from the Conscious Flotilla, they have been abducted and tortured by Israel. They were released. He just made it to Florida. Hopefully, he will be joining us soon. He's in a protest now in Florida. In the meantime, we can have some feedback from our panelists, some reflections on what we had today. We did not hear from Faisal for a while. Faisal, if you're still there, we want to hear from you. Faisal? Okay. Faisal might be away. So let's start with Marta. You've been very active in Boston, so tell us what's happening. Oh, you're muted, Marta.
I'm
okay.
I'm
No,
unmuted
you're good now.
We were in front of BCG, Boston Consulting Group, the other day.
Yes.
With Karama and Eileen, myself, a bunch of people, and Anthony. And I see that, I think earlier they were talking about they dismantled the setup.
The GSF.
Which is great, but also war crime investigators won't see it.
I mean, I hope that, yeah.
Anyway, yeah, we're doing that. We're hoping to have an event at another event at my parish with Claude and Karama and possibly Anthony. Still sorting out that, finalizing that. And The hunger strike group kind of ended. And we're looking forward to coming on the 19th. Eileen's coming also
Great.
to Washington.
Thank you so much.
Great.
There's a good chance that we will be done in 3 hours today.
Yeah. Faisal, you never
Amazing.
know. Dr. Ahmed Farra might join, people from
Oh,
Sudan
yes,
might join,
Dr.
Dia might join. Whenever we feel we can finish early, something comes up. So, Tom, are you there? Faisal? Tom? Oh, okay. We have Dr. Roxana Tamimi. Tom is walking. Look what he's doing. Tom?
I defer to Dr. Sanimi. I can go next.
Roxana, how are you?
I'm okay. I'm gonna defer back to Tom. Give me a second.
Okay.
Okay, I'm ready now. I was doing some cleaning when listening at the same time. So I'll go ahead and react a little bit. I was really struck by Dr. Ang's words after the presentation by Nick Maynard. We have so many good 10 to 15 segments that are so powerful. I mean, of course, the larger speeches are also very valuable, but I'm thinking a lot. I know that we already put those, we make them available, those shorter segments, some of them anyway, on YouTube. I've really been thinking, and I want to keep thinking about ways to more to package pieces like that so that they can be as spoon-feedable to journalists and policymakers as possible. I mean, I'm thinking about the fact that we are in the moment of ceasefire. Hopefully that will hold. Sort of a best case scenario is that it will hold and that more aid will be able to come in. But I think that it's been so difficult to penetrate American consciousness already. And that might become, I'm not sure, it might become even more challenging now that, if this ceasefire holds. People will they'll want to move on to the degree they've been paying attention at all. They'll think, don't go back and, keep bringing this up. It's all good now. I mean, that will be their attention span, right? And I think that, I'll put myself at the center of this, of wanting to think about ways, I mean, that it can be packaged and contextualized in a way that it's just very accessible for journalists to use, either to edify themselves, maybe even to grab small pieces of it. Perhaps a lot of this has already been done, but I want to see what I can do to help facilitate it working even better. I think I had another comment, but I'll save it for later.
Yes, I agree, Tom. Thank you. Roxanne, ready now?
No, I was listening to Tom. I didn't take the time to think, but we're all family, so here goes. Well, several things. I mean, you guys might have noticed that I was just randomly videoing it. Hopefully I was trying to get some little pieces that I could put up on, just start my own social media, et cetera, just donations or whatever, just to spread awareness. So that's what I was doing. But the fact is I felt comfortable enough doing that with you guys. No, Nadal, you're looking at me like I was doing like this with the phone.
Yeah.
Okay, so that's what that was.
Oh,
and
okay.
then, and, hearing of another death, we were together when Anas's murder was announced. And so that was very heavy. And so I would say, again, it's easier when we're all together. And again, I really appreciate the colleagues from Gaza when Iyad is coming in with his children and smiling. And also he knew that I wanted to do a post. He was very well aware that I was waiting for today to get a post and a picture. So the second he showed up, he knew exactly why I had the video and the camera on. But to see him, it does fuel us to keep going, because how can we not? And so I really appreciate these weekly webinars where, I know Dr. Al-Fatah always says we fuel him, but you guys fuel me, but, having him and his testimony fuels us. And Claude and Khadija, I did try to get some pieces. I don't know if I got the right time because, I basically videoed the whole webinar. but hopefully, we'll put something together. And I really appreciate, again, Claude, you did start it off with, for those who don't know me, and you gave a little bit of a history again, and every time you guys give that history, I think it sinks in more and more, and so I appreciate that. And this is how Nadal recruited me, this one. I just was walking him in TJ Maxx, and this is how he finds his members.
Thank you, Roxana. Thank you.
Oh, wait, no, I have one more thing to say.
Yeah.
Okay. And this is not centering myself. I just was going to say, and that Dr. Maynard's, and I know you guys saw it in the group chat, some of you, that the 16-year-old with that abdomen, that is such a senseless loss. And I know that a lot of them are senseless losses, but that one particularly upset me. Not for me, but it upset me because I had an abdomen that looked exactly like that, if not worse. And here I am, and I'm able to function. And it's completely unacceptable that a 16-year-old should pass away for something that preventable. And I know there's more preventable DKA, MIs, and all the other, preventable medical things that have been going on. But that one, because it's like, here I am. And I said it in the office the other day too, to one of those guys. I said, clean water paradoxically can dehydrate someone in certain situations. And there's not clean water. So you're just killing off people senselessly. So when he showed that picture, it's not that it triggered me for myself, but it bothered me because I had an abdomen worse. And here I am. And I'm functional and I can do anything. And so that's not acceptable. I know we all agree, but you can tell I'm passionate about that because that was specifically complete. I mean, they're all inappropriate, but that one, it was so senseless. They're all so senseless.
Yep, I agree. Indirect death due to the genocide. Dr. Swiyang, are you there? Dr. Sui? Okay, Faisal, you're back. We haven't heard from you for a while, Faisal. Welcome back. Thank you.
I've been traveling in Scotland. We set up a new museum in Edinburgh, the Palestine Museum, Scotland.
Great work.
Thank you. And we're working on a couple more places.
What do you think? What do you make out of all what's happening? What's your
in Gaza?
Yes.
Of course, I don't trust the Israelis. The only possibility is Trump, which is very unpredictable. So the question is, how is Trump going to react when the Israelis break the ceasefire? And sooner or later, it's going to happen. I just read a statement by one of the Israelis in the cabinet saying that as soon as they retrieve the hostages, they're going to proceed to destroying the Hamas tunnels. How are you going to do that? You have to bomb all of the strip to do that.
You have been doing it for 2 years already.
Yeah, well, they haven't got much done.
Yeah.
But I mean, we're talking about having to put these big, huge bombs and drop them everywhere to try to destroy the tunnels. The tunnels are 70 meters below ground. They can't just get them by dropping regular bombs on them. I mean, they're talking like that already, and it's only been like 2 days. Just think what's going to happen. So I think there's a 50-50 chance of this thing working. The only reason it would work is if Trump puts his foot down and forces Netanyahu to behave and to comply with what was agreed to.
Yeah, I agree. We have to keep the pressure up.
What are they going to do once they receive their hostages or their prisoners, we should say? That's the key question.
Yeah. Okay. Thank you, Faisal. Thank you for all your hard work. Thank you for joining us.
Thank you.
We're going to go to Dr. Shitab. Mariam Shitab, are you there? Mariam?
Yeah, I agree with Faisal. For the people in Gaza, I want them to have whatever happiness, joy, the announcement of a ceasefire brings. They deserve so much more than that. But for the rest of us in the West, we can't take this as an excuse to become complacent, because now is when we have to be watching closer than ever and apply just as much pressure, if not more, because no oppressed people ever got their freedom because of an agreement with the people who are oppressing them. So now is not the time to think that we are allowed to take a break and take some deep breaths. No, we keep pushing forward and we keep watching them. And we take every example of what we know the Israelis are going to do and are already doing, and we take that to our elected representatives and say, see, this is why we told you, you have to hold them accountable. Not whatever an Israeli is lying if their lips are moving. We've seen that over and over again. They said they were going to start letting aid in today. There's no aid coming in. There's no medication. Nothing has changed on the ground. So let the people in Palestine and Gaza celebrate while we do the heavy lifting. But don't take your eyes off of Gaza.
Yep, I agree 100%. You can never trust more criminals and genociders, and I mean, this thing is built in them, built in their project, built in their society, in their media, in their politics, and the whole project. So we have to keep doing.
They've
all
almost
we
got
can
what
to
they
fight
want.
it.
They've almost got what they want. When you see the split screens, it just breaks your heart. So we have no reason to think that they're going to stop here. You know, we're hoping that a man-child that holds the highest office in the land is going to be the barrier. I mean, while his son-in-law is heavily invested in everything. So we take this moment and we push back harder.
Yeah. Thank you. Dr. Sui, are you still there? Dr. Suyang? Dr. Sui? Okay. We have Maisa Asir from Jenin. Are you there, Maisa? Do you hear us? Maisa is the director of Al-Shifa Hospital in Jenin. I'm not sure if she can hear us or not. She joined late. Maisa?
مرحبا مرحبا.
Hi, Maisa. How are you?
Fine, thank you. How are you?
Good. Thank you.
يعني bad news from Gaza about Saleh. My
I know.
God.
We're all
صالح
heartbroken for him.
صالح يعني انت لو تشوف قديش احنا زعلانين عليه زعلانين صالح يعني اشي كبير 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 يعني في هلا مرقت في بنات بتعيط بالشارع عمالة عليه.
Wow. People in Jenin, the West Bank, are crying the streets for the loss of Saleh.
صالح
It's a nice
أيقونة
soul that
أيقونة.
everyone loves him, and he's there in every house.
Yes. يعني يا حرام ما فرحش على النصر ما فرحش يرجع على بيته يعني very sad very sad.
Yeah, I'm sorry about that. Yes, I agree.
Yes.
I
Yes.
just saw a video of him. I remember yesterday, the day before, he was so happy and kind of
Yes.
finally, thank
Yes.
God, we
Yes.
made it. We survived.
Yeah.
And for him to be killed this way, it's just horrible.
يعني بتعرف دكتور بدي احكي شغله بس الوجع هلا بده يبدا عند اهل غزه الوجع لما ترجع كل عيله على بيتها مش موجود اللي خسرت ابنها اللي خسرت عيلتها اللي خسرت حياتها هم لحد اليوم اهل غزه لسه ما توجعوا الوجع الحقيقي جاي بعدين بعد فتره.
Maisa is saying that the pain, the heartache for the people of Gaza will start now. I mean, so far they have been in a survival mode, fight and flight, and they did not realize the impact of the huge amount of the loss they went through. Now, if the ceasefire, works or sustained or lasts, they will start feeling all of it. That's why we need to be with them and supportive of them now more than ever. I agree. Thank you, Maisa, for this.
You're welcome. إن شاء
May
الله
God protect
يعني
you in the West Bank too, and inshallah, I'll check with you about that contract. So things are good with Al-Shifa Hospital in Jenin too.
كل شيء تمام هم حكوا كل شيء تمام شكرا كتير دكتور. Thank you very much.
Thank you. Anytime.
أهلين.
Join us every week whenever you can, please. Dr.
Of
Salman
course.
Khan, any reflection on what you heard today overall?
Just thank you so much. I'm very grateful to be a part of this community, and very grateful to hear from the voices of Gaza, and sort of cautious optimism, I think, is a vibe, and knowing not to trust the occupation, and that the ceasefire is really just the beginning, and it's not justice, and we have to just continue onwards. Thank you.
Thank you, Salman. Karama.
Oh, thank you, Nidal. Yeah, just like I feel that the one thing that has worked to come to this point with the ceasefire in Gaza is serious and intense public pressure. Even when we felt it's not working, I think collectively the pressure ultimately has made it impossible for the bombing campaign to continue. And the minute we let go of this public pressure, we may find ourselves in free fall into genocide once again. So I urge everyone to not let your guard, continue thinking about ways to bring what is happening in Gaza to the forefront, continue being active, organize. Do not feel that it is over. It is not over. The rebuilding is massive, and protecting ourselves and the people in Gaza from having another round of violence is just around it's really just around the corner. So we cannot let our guard down. We should continue to organize. And my other reflection is that the mechanism of genocide is the same everywhere. It repeats itself. The genocidaires are creative, but their creativity is very predictable. They are very similar. So it is restriction of food, restriction of movement, bombing hospitals, bombing schools. We're seeing this in Sudan exactly like it is. We are seeing it in Gaza.
Okay, Karama, let's go to Dia from Florida now. He just came off the flotilla and protesting right away.
All right.
Dr. Dia Dawood, he's an emergency room doctor from Florida. He's originally from Gaza. He was on the conscious flotilla. They were all abducted. He just came back this morning, and mashallah, he's already protesting. That's his protest. That's him. Was a tough man. Yeah, we hear you, Dia. Talk to us, Dia. Tell us what happened. We don't hear
So after myself and these beautiful people went in the flotilla, and we sailed for almost 10 days with this amazing captain, Captain Madeline Habib from Australia. Such an amazing woman with an amazing heart, who had one intention, is to take us to Gaza, to drop these beautiful people with their symbolic aid towards Gaza and make the Gazans happy. That's all what we wanted. We just wanted to make them happy. We knew that we didn't have a lot of aid that will help 2 million people. We knew that, but we just wanted to make them happy. We wanted to break the siege. We wanted to do that for them. But instead, these pathological people, these cowards, came in with their helicopters, and they went on top of us for almost 10 minutes, and we were all scared, and we were all looking at these people, and we're like, what have we done to you to deserve this? We only had aid so that we can help these people, but instead they came in with all of their artillery, and then they went down on the ship, and then they came in, and then they abducted us, and then they took us towards the Ashdod port in Haifa. They escorted us over there, and then after that, they took us one by one. They took all of anything that says Palestine or a kufiyya, they took it from us, except one guy. His name is Ali. He's a journalist. And like I said, on the boat, there was only two kinds of people, either a journalist or a doctor. And then they took that journalist and beat him up so bad, to the point he almost lost consciousness. And then when Adnan, another brave guy, another brave journalist came in to defend him, they also beat him up to death. Came to this genocidal regime. Are you surprised? I'm not surprised. I'm not surprised. They killed 600,000 people, estimated 600,000 people that we know of. Are you surprised? No. No, that's what they do. That's what they're really good in. Killing people. And then they took us and then they made us sit on our knees for 2 hours. We stopped feeling our knees. We stopped feeling our toes. We stopped feeling our necks because you have to bend down and then you have to put your head on the ground and kneel like that for 2 hours. And guess what? According to me and according to the previous people from the Samud flotilla, the whole entire area was filled with urine smell. They peed on it and then they made sure to humiliate us before we come there so that we can smell this nasty smell like them. And then they took us, and then once we stood up, we were disoriented. I remember myself swinging right and left. I couldn't tell where I'm at. Because after 2 hours, you're about to lose consciousness. And then after that, they took us and then they assigned an officer, a genocidal officer to every single one of them. And they took, and every single one of them, they had his hand on our necks, treating us like terrorists. And when I asked a lady over there that this guy is abusing me, I am no threat to you. I am a doctor from the United States. I came in a humanitarian mission. You know what she told me? She told me, because you are not white. Yeah! It took me a little while to comprehend what she said. But there was no surprise. Somebody who's committing a genocide, what do you expect from them? What do you expect from them? Racist cowards. Well, that's who they are. They took us over from the port of Haifa, which is Ashdod, all the way. And we met the Adala lawyers who helped us in arranging for us, just in case we were abducted. And sure enough, they were there. They helped us. And then we signed papers to be deported from them. And then they asked us, why are you here? We said, we are not here because we want to be here. We're here because you abducted us from the international water. That is a crime. That is a crime that they should be prosecuted for. They abduct people. And that is no surprise. They abducted 2 million people for 20 years in a big air prison. That's who they are. They took us, and when I asked for a jacket, they said no, and I didn't know why. I said fine. And then when they took us in a bus, and they escorted us to the detention center in the middle of the desert, it was so cold. The weather over there was about, I would say, 40 to 50 degrees Fahrenheit. And the bus was put in a 0 degree Fahrenheit. It was ice cold. Ice cold. We were shivering for 2 hours to the point that almost all of us passed out. Hey. And then they took us and we arrived, free Palestine. And when we arrived to that detention center, they took us and then we looked around and we couldn't see because they put a band on our eyes and they put zip ties in our hands, so tight that we couldn't even have any blood supply to our hands. Our hands were numb. And then they took us and then they made us go inside a cage. They took the band out, and then when we looked around, again, we were disoriented, and then we looked, and then there were hundreds of these monsters surrounding us. Free Palestine! I felt good when I saw my comrades. They put us in a cage. They put us in a cage, and some of them were sitting in a little chairs that were surrounding the inner side of the cage. And then they came in with their sticks, and they were telling us on the floor to sit and kneel on the floor. And that's what we did. And we were so scared. I'm not gonna lie to you. I was scared. I faced like what every single Palestinian is facing in their detention centers, sitting there without any kind of future, uncertainty. That's what I faced. And it's such a scary feeling when you face uncertainty because you don't know what's waiting for you with these vicious monsters. You do not know. They came into me and they said, "You're a doctor, right?" I said, "Yes." And then they said, "Do you know Hussam Abu Safiya?" Hussam Abu Safiya is a doctor who is until now, he's a pediatrician. He's a doctor for little kids. He's just all what he did, all what his problem and his issue was. He just cared about little kids. He cared about them. You know, I tell Hussam Abu Safiya, Allah yafik asrak.
Amen.
Allah yafik asrak. May God free you from this vicious people, from these genocidal regime. And then you know what? They put a Free Palestine band in front of me and they said, "Do you want this? Do you want this?" And I didn't say anything. And then they asked us to spit on it, and we didn't. And then they asked us to say, "I love Israel," and we didn't. How could you love a country like that? How could you love a genocidal regime like that? How? How would you support a genocidal regime like that? I ask every single representative and a congressman and a congresswoman, how could you do that? They put us in our rooms, and there was 5 people in every single room, or 6 people. And it was the best moment in my life. I was so proud, but I was warm above all. I was shivering for 1 entire hour. 1 entire hour after they took us out. And in all of that is 1 of 1,000 of what every single Palestinian is facing in these terrorist country. That's what they're facing, and more. They're facing dogs biting them, dogs doing things to them, rape, sexual assault, everything that you can think of, and murder. They murder them in the jail. I saw somebody who had a handwriting with a little nail, probably, or something on the bunker bed, in a metallic bunker bed. And he says, "My name is Marwan Fathi Abul Qara. I have 2 little kids who are shaheed, Asim and Fathi. I was detained in 1/1/25, and I'm here to tell his story." One person among thousands of Palestinians, children, men, women, old people, a lot of them who are facing uncertain future. And it's such a scary feeling. It is such a scary feeling. But you know what we tell them? Free Palestine!
Free Palestine!
Free Palestine! Free Palestine!
Free Palestine!
Free Gaza!
Free Gaza!
Free Gaza! I just want to say one last thing. I want to say that you are as brave as everybody else. Every comrade that went with us in the flotilla, I want you to go and insert the flotilla, and I want you to stay out there, and I want you to break the siege. And if you can't, support them, because they deserve your support. because that's the only way that we can break the siege and free Palestine. If you are waiting for other countries, the genocidal countries around them, like Egypt and like Jordan, if you're waiting for them so that they can free Palestine and allow humanitarian aid, you are mistaken, because they are in bed with this genocidal regime. It's so sad. It's so sad that we had us, the civilians, to go and sail and risk our lives so that we can go and break the siege. It is very sad. But you know what? We do it with happiness. We do it because Gaza people deserve to be free. They don't want your humanitarian aid. They don't want your pity. They are free people, and they deserve to be free. I just want to introduce my wife, Dr. Huda Al-Junaidi, who is the true inspiration for me, who is truly the reason why I went to Gaza two times. And I just want to say thank you very much for being there for me. And thank you for being an inspiration for me.
Do you guys mind taking this from me?
Oh, yeah. Gotcha.
My husband asked me, out of no time, nowhere, are you okay with me going to the flotilla? I told him, without even thinking, it is wrong not to go.
That's right. That's right.
And he asked me, just a reminder, we have 4 kids. I told him it's wrong not to go.
That's right.
He told me, you know, I might never come back. I told him it's wrong not to go.
That's right.
He told me, my mom and your mom are depending on us. I told him it's wrong not to go. Wrong. Flotilla is symbolic, grassrooted. It wasn't planned. It was people like you and I. We walked on the street. They just said the ocean. They grabbed their own boats. They bought their own stuff. They volunteered. They gathered. They took risk their lives. They couldn't even coordinate because it's very, very small base mission. Reflects their anger, reflects their curiosity. They couldn't do it anymore. Just watching behind phones. Guess what? Good job, Flotilla. Because you robbed that Bibi Netanyahu's ego so bad. Woo! He had to send Navy SEALs. They didn't know how to send through the ropes just to abduct you in international water. Sorry, we robbed your ego because you're so much used to get away with everything you do.
Yep.
You are used to buying out every single government on the globe. There is no price tag to our free speech. Woo! As much as helpless we feel we are, guess what? Our standing here is bothering them so much.
That's right.
Yes. Woo! Social media makes you a target for them. It's bothering them so much. Woo! So desperate, they are buying out votes to speak propagandas. This is how angry they are of you. That means we are doing something. Woo! Woo! To every person, to every family, shame on you, Obama, because I'm sorry when you describe the Israelis' families and then you said, Gaza people, sorry, master, we are the Palestinian families too.
That's right.
Woo! Watch your words. Palestine is families. It's a grandma. It's a great grandma older than the fake Israeli state.
That's right.
Woo! I'm telling you something. The little thing we are doing is flipping them over. And that's why they got on their knees for a try to ceasefire. They know there is no price for peace. You have to come and sit on a table and agree to ceasefire. We know though, whether there's a ceasefire or not, whether the war stops tonight or not. Gaza's redemption, Gaza's rebuild, the rescue of the Palestinians is far, far from being met. That's what Allah was a start. Israel needs to know that the thousands of people on the street now will be thousands will be adults in the sea. Right? Why? Because thousands already. They come to India, to Palestine. That's all the way from Texas to Sarasota. And they still were stopped and interrupted by the shameful Egyptian regime. Sad. We don't have to go through water to take formula. What happened to the roads? What happened to the crossings? Why are they making us angry about food and not leave us with enough time to object the genocide? Not even leaving us with enough time to say there is 20 years old siege in Gaza, that there is 80 years old occupation in Palestine. I'm sorry, the fight isn't about to be over. This is a marathon. And if you're going to be targeted or hurt, as Dia said, if you're not willing to put the sacrifice, I'm sorry, we're not going to get what we want. What do we want? Free Palestine!
Free Palestine! Free Palestine!
Thank you for Dr. Dia and his wife.
All right. I have
Claude,
one more
brave
speaker
doctors.
before I go and do some chants. How are we feeling? Are we ready to stand with Palestine?
Karama, you have the. Can we mute them to hear from our
who's not here with
doctors
us in
New York?
person, who's
Then we
joining
can
us
go back to him.
from England
Karama?
via FaceTime from Wales.
Yes,
I'm sorry.
yes.
I apologize.
Yeah, please, if you can mute Dia. Okay, we have the brave doctor from New York. What did you do to New York today, Maribeth and Alisa?
Hi, there's a light back here. Woo! Can you? I don't know if it'll pick everybody up in the back seat there.
Maribeth, remove your background and your blur thing.
There we go.
Oh, wow, you have a whole bus there.
We did a
Adla is there too?
What's that?
Adla is there too?
Yeah.
Oh, you're all doing marathons behind our back without telling us?
Marathon's behind his back. You think I just dressed up in race gear for fun and sent you a picture? Did you hear?
No, I did not hear. Say it again, please.
No, I said, did you think that I just dressed up in race gear and sent you a picture for giggles?
I thought so. Okay.
No, I actually I'm on hospital service. I took off. I took
So
a
who
train
was
to
the
New York
fastest?
last
Who
night.
was the fastest today?
We were all slowpokes. We were drinking coffee and strolling.
Can you tell us what was the event? Tell the people here what did you do
It
today,
was
please?
UNRWA 5 Gaza 5K.
In New York?
Yeah, in Brooklyn. We were hosted by Alyssa.
I see Dania in the back, always in the background, Daniel.
Yeah. So it was a very lovely event. There was like 4,000 plus people, I believe.
I think they said
largest yet. Largest one yet. Lots of funds were raised. I think like close to 1.7. Was it like 1.7 million?
I mean, some hours ago, I got a text
Some-
that they were only 200K short of like a 2 million goal.
Yeah, there was like a 2 million goal. They were very close to that goal. Mahmoud Khalil was there, and we got to.
And our pal Hani.
And Hani was there.
Oh, Hani was there?
Yeah, he sent his regards. We saw lots of lovely people. So it was a really, really nice event.
But we have a very good DAG delegation. Good.
Yeah.
About 10 of you guys?
No, about six. But there were also
Six?
a lot of healthcare workers for Palestine group
Okay.
was there. So it was nice. And I'm happy to say that my colleagues back in Virginia were fighting over who was going to get to cover my shift today so that I could attend. They said it was a quote unquote very good cause. So it was nice.
That's good news.
Yep.
Did you get us some of that money, or it's all going to UNRWA?
It's all going to UNRWA. But we
Yeah,
did make some contacts of some people who would like to get involved. And I think we handed out 50 pens maybe
Yeah.
of healthcare workers that want to join DAG.
Nice. That's good. That's great. Thank you. Thank you. Great, great
Yeah.
job, guys. Thank you for doing it. Thank you for going. Thank you
Danya.
for presenting.
Danya.
Danya,
Tanya. She says it's fine. We did, I swear, a dad conversation recently was like, do we have any dentists? Why don't we have any dentists? And lo and behold, some gal came up to us today and was like, hey, I'm a dentist and I've been like working on getting dentists against genocide off the ground. And I'm like, you know what? We need some dentists. Let's all just get into one club and work on this. And so she, in fact, I have her cell phone. I got to text her back so I can get her signed up to do DAG stuff. So yay, we'll have a dental contingency now in DAG.
would they do free dental service for DAG members? Because I need that badly.
I don't know. I don't know.
It's
We'll
not
have
that
to,
far.
I don't, wait, maybe. And there's Alyssa.
Hi, Alyssa. How are you?
Buddy. Anything you want to add?
No, not really.
You want to say anything? Say hi. And we have a new DAG member who doesn't feel like he wants to say anything.
Hi.
He can say hi.
Hello.
We
Salam.
clearly
Hello.
see he's
Nice
already in
meeting
my
you.
car, so he's stuck now.
Yes, exactly. Salam, everybody. My name is Dr. Abdurrahim. I'm a pediatrician, pediatric resident, and I've been in the DAG chat for a couple of months now. I saw that this race was happening, and I wanted to involve myself, meet like-minded people in person. So, alhamdulillah, I'm grateful for everything that you guys do. I'm grateful for this organization, and I hope we continue to fight the good fight.
Thank you, Abdurrahim. Welcome to DAG. Thank you for doing it. Are they all in your car, Maribeth?
Yeah, the luxury
You have
bus
all
here.
these things on the outside, or
Do we what?
do you still have all these, writings on the
All the
outside of your
flags
car?
and stuff outside. Not right now. It's raining.
Oh, it's raining.
We got one on the inside. Actually, Alyssa brought a whole bunch of these tiny flags that she had just randomly, a whole bushel full of tiny Palestinian flags. Because when were you handing them out?
During the New York City Marathon.
Yeah.
I live right on the what is it? The trail for New York City Marathon. So last year I was handing a bunch of them out.
She was just making people take Palestinian flags last year. Take it. And so she brought a bunch today, and then a lot of little kids were super excited for DAG to hand out tiny Palestinian flags. So that was, good public relations for DAG.
Got it.
Mm-hmm.
Thank you. Thank you, everyone. Be safe. Be careful, Maribeth. Drive safe. You have
I
half
can't
the
promise
DAG
anything like that.
contingency in your car now, so you have to be careful with them.
Yeah, and we have the DAG playlist. We'll put the music on.
Okay, perfect.
Curated by
What
Dr.
does your
Najat Kapoor.
playlist start with? What's the first song on your playlist?
What do you think?
Bitch, don't kill my vibe.
Wayne and out of your Wayne. Maybe. We'll
Yeah.
see. Some Julia Boutros. I don't know.
Yeah. I love it.
Who's way back? Who's way in the back?
It's Danya. And my
No,
friend
there's somebody next to her.
Who's next to Dania?
who runs the Montco organization, because Madeline Dean is her congresswoman.
But who's next to Dania?
Oh, next to Danya.
Oh.
No, here, they want to meet you, Naz. Wait, let me see if I can put these lights back. All right, this is Naz. Assalamu alaikum, everyone.
Assalamu alaikum.
Walaikum assalam. I'm Naz. I'm with Manco for Palestine in Pennsylvania. Run a little small organization where we try to raise awareness about what's been happening. We try to do like educational events, tabling events, whatever we can. And we also do donations for this chef named Chef Hasuna, who's been trying to feed everyone over there. So we try to send money to him so he could.
Thank you. Do you know Dr. Claire Cohen?
I couldn't hear.
No, she's in Pittsburgh.
Oh, okay.
See, now you're on Bluetooth because I had to turn my car on, so I don't know if I sound like I'm yelling to you also or just to the people in my car.
You're always yelling. That's your default setup. So it's no news. We're not surprised.
I am just full of passion and vigor for
Yeah.
humanity.
Well, it's nice meeting you all.
Okay, guys.
Amazing work you guys do.
Thank you. Thank you. Thank you for your work too. We're all in this together. So
Assalamualaikum.
Are we dismissed?
no, I mean, it's up to you. What do you have to share anything? You want to share any more stuff?
Right. Who? Dr. Ahmed? Oh, has he been on today at all? Dr.
We're waiting
Alfara?
for him. I
No.
was hoping for him to show up anytime, but not yet, unfortunately.
Okay, well let me drive my precious cargo around where they need to go. And then if it's still going on, we can check back in and see who's on. Okay?
Okay. Be safe.
All right.
Thank you,
Bye,
Maribeth.
guys.
Thank you,
Bye.
everyone.
Bye.
Good to hear from you. Okay. Dr. Ahmed did not join. Usually he gives us a better end of this webinar, but it's okay. Hopefully we'll hear from him next time. I think we are done for the day, guys, unless if anyone has any final comments. And again, we have to keep up the fight. The people still need us. It's not over until it's over, until the victims are safe, and until the aggressors are held accountable. And we appreciate every one of you, appreciate the work of each one of you, and each one of us can do something. Can be small, can be big, but we have to keep doing all what we can, trying all what we can, mobilizing more people, and to make sure that what happened over the past 2 years will never happen again, whether in Palestine, in Gaza, or anywhere else in the world. That is our promise as doctors, healthcare workers, as Doctors Against Genocide. This is a global community for humanity, and we need to keep trying to mobilize our medical community to be on the forefront of defending life, protecting the sanctity of life wherever it is, and also to remind ourselves that attack on human rights, on lives here in the United States and in the West, especially in the immigrant community, the minorities here, because we know that those who commit genocide abroad will bring in fascism at home. And if we are allowed them to get away with the genocide, then we will not be safe at home too. It's all one humanity. The victims are all the same, and the aggressors are all the same. The systems that are exploiting all of us are the same. So the fight is one. And we are again not against anyone. We don't hate anyone. We are for a better humanity, a more just humanity, where every life counts the same and equal. And we think that there is enough in the world for all of us, and there is no reason for people to keep fighting against each other, being manipulated by the ruling class, by the elites, by the hyper-rich, by the wealthy, by the war profiteers who are benefiting from our death, from our killing, from our destruction, from our new day slavery, from our divisions, from our mischaracterizations in terms of color, race, religion, nationality. Because at the end of the day, we are all human, and we go to school as a medical community to protect humanity and protect life, every life. Thank you, everyone, and keep up the good work. And please spread the word, bring more people to join. Let's change the world. Let's create a better world for everyone. We were supposed to hear from Jihan colleague, Dr. Izzuddin Abul Aish, but I think he could not join us. hopefully we can get him next week. He's also a very prominent voice doctor from Gaza who lost his daughters 10 years ago in the 2014 attack. It would be interesting to hear from him too. Hopefully we can get him on next week. Okay, guys. Salam. Salam, everyone. And we'll see you next week.